So, all right, we're live. On my end. Okay, so just for um, my stream, there's no one here at this point in time, but just for posterity's sake, what our good friend Dr. Greg brought up is I think something really interesting and something I've talked about before. I've and remind me about this later in case I might forget about it. There's a trans angle to this, so like in case I don't bring that up. Um, anyway, so what Dr. Greg just asked was, should would it be a good idea, or what are the dangers that we might face if the United States switched to a single payer system, a healthcare system, and then at some point Republicans, this is going to be under Democratic administration, but at some point Republicans will be back in power, right? And those ideologues, those radicals are back in, and what'll happen, right? Um, so this has been brought up to me before, and I feel like one, these other countries have to deal with exactly that, right? That people or individuals and parties that are skeptical of their single payer systems, and like they withstand that. Why do they withstand that? Because two, these things are popular, right? That's why like Medicare, the veterans uh, assistance, medical assistance, whatever it's called, the VA, right? That those all still stand. They're battered, absolutely battered, right? But still not dead yet. Despite Republicans desperately wanting to take those down, because um, whenever you have a universal program, they become extremely popular, right? And becomes extremely difficult. That's why they fight tooth and nail, and Democrats as well, right? Liberal Democrats as well, to keep this from happening, because they know once it gets in place, it'll be nearly impossible to get rid of. They understand, they understand how they're not idiot. Well, most of them, some of them, most of them aren't idiots, right? And they understand like the deficiencies of our current system, right? They understand that it exists, right? But they're just being paid by the people who benefit from those deficiencies, and so like they ignore the issue, but they understand, right? Even if they can't come up with something better, right? Even if they're ideologically against a single payer, right? They've proven they have no other better ideas. Um, but so they get that, and they understand on the other side of it that if it comes in, it's popular. They know that those other countries, right? Even they pretend that Canada is just some wasteland, medical wasteland, right? Where no one gets care, or it's like a complete mess. They know that these systems have popular support. They have popular support in England. They know that when those people look at the American system, they're like, absolutely not that, right? We don't want what they are dealing with. So they understand all of this. And so that you have to keep that in place. But that doesn't completely deal with your question yet, because what happens when we are in charge? Yes, it is a danger that they can alter the system to be less responsive, but just degrade the system in general. Capital, right? Like money will the money will come in to try to degrade this, right? Like the system comes in, right? Let's say it's everything you and I want it to be, right? Day one, day two, they're introducing amendments, right, to immediately degrade service. That's what that process would be. And then but like, I mean, that's just like part of the political process, right? That's just what it is, right? It's gonna be a tug and a pull. I don't think they'll be able to destroy it. So especially once it gets in place and people actually get benefits from it. We saw this from Obamacare, right? Like they were easily able to propagandize against it. And it's a Republican system; it's not a great system, but still, right? They were easily able to propagandize against it at the very start. But then later on, when the uh, patient protection portion of Obamacare kicked in, right? People saw those benefits. They're like, well, we don't take those away. That is an improvement from what we had before, right? So there's that. But the last piece would be, like I was saying, trans, right? Or any other group that is like, not favored by the state. Um, like one, right now, we see that like within our current system, we see that like Republicans have the ability to degrade care. They're saying that, hey, you can't provide trans affirming care to minors, right? Even these aren't surgeries. There's a whole list of trans care, right? That's not like giving them chemicals or giving them surgery. There's like a whole list of things you can do, but they're saying no, you can't do any of that. So one, that already exists in our system currently. As it stands, they can still screw with your health care right this second. And in two, I still think even in the worst case scenario, like we turn out better. I was arguing about this with a trans woman, right? Well, a trans woman who lives in England. This is years ago. But she was skeptical of these systems because, she's actually living through like this scenario that our friend Greg is talking about, where before it happened in the US, right? Before the anti-trans wave happened there, it happened in England. If you remember the timeline there. And we used to call it Turf Island. It was really funny, but then it happened to us. So she's living through that. And look, I don't know if there's an easy way to address that issue, right? Other than to say, well, there'll be a political pushback on this, and that like, eventually others like will get into office and we can, pull things back in a better direction. And also, secondly, and this is the last thing I'll say, even in the worst case scenario, and I argued this to her, even in the worst case scenario, you're still out ahead. Because you know what else trans people need? They need generalized healthcare, right? And they're not getting that either. So many of our trans brothers and sisters are actually, low down on the economic scale, right? They've like been rejected from their families, or they're denied economic opportunities. A lot of them don't have basic health care. So even in a system that completely denied them trans care, if they had all the other basic care, they'd still be out ahead. And there would be other avenues, private avenues they could use to get the secondary health care. Sorry, they might not consider it that way, but the other types of health care that they desire.
So, but Prime, who would decide what is like in good faith? Like, who would be the decider on how, how we legislate the healthcare administration? Like, who would it be? The legislators, passing bills? Would it be the Constitution? Would it be like a third party thing, like the APA, AMA, like these other, these other non-governmental kind of bodies that are like physician groups and that kind of thing? I mean, how would they, in a good scenario, in a good faith effort, like how do we decide what the best practice should be?
That's a good question, and not something I necessarily considered. I mean, we can look to other countries to see what they're doing, but like, I would be fine with having a body, a technocratic body that could do this, right? Like, of like not political appointees, a body of individuals, have a level of expertise that can put on a panel and do that right now. That's just because they're not political appointees doesn't necessarily mean it can't be corrupted. We're actually seeing that right now in terms of our government institutions. So nothing is safe, right?
Yeah.
It's just the way it is when it comes to government. But I think we can come up with a panel, have like a regular review process of what is and what isn't, right? I'm a little skeptical of like outsourcing it to something like the APA or whatever. Like I'd actually rather it to be government employees that we can mandate, hey, you can't take a salary from somewhere else, right? You can't be paid off by someone else. Have a bit tighter control there. But I'd be willing to, listen on that. But yeah, I don't know.
Well, I can speak to my experience. So, in Canada, like,
tell us how the adults do it.
And obviously, this is not representative of every other country that has public health care. Like, I have limited information on how the NHS runs, but yeah, here in Canada, we have public access to healthcare, but it is provincially run. As in each province essentially manages the healthcare of that province. So where I'm located in Quebec, and I can, maybe provide some insight in terms of how this technocratic institution that Prime alluded to is like, so, to be transparent, like I'm on a medication and I'm on a very expensive medication. It's about, $4,000 per month. I pay $100. Okay.
Wow.
And it required special approval to be put on it. As in, like, my doctor had to write a letter saying, hey, we tried other medications, like this person like needs it. And like, so we have an institution, it's called the RAMQ. It's a French word, the Régie de l'Assurance Maladie de Quebec. Basically, Quebec health insurance, more or less. And like, they submitted the paperwork and they approved it, saying that, hey, we'll cover, pretty much, 95, 98% of the cost. And, you're mandated to pay the $100 pretty much each time, as opposed to the $4,000. And so far I haven't had, and I've been on multiple medications that require this process, and that's through both conservative and liberal governments. And I personally haven't had any issues, but that's just me and my experience. I'm not saying there's no issues whatsoever.
But let's say you moved like to British Columbia or something. Like how would you transfer? Like, could you use RAMQ still in BC, or would you have to transfer and then all the paperwork would go over there and then it has to be independently reviewed?
Yeah, I believe if I permanently relocated to a different province, I will have to register for that province's healthcare. Because like unless I'm visiting, but then it's like, let's say if I believe I've never had to do this, but I believe if I go to, let's say, the ER in Ontario, and let's say I don't think I'd have to pay, but rather like, yeah, I'd have to. I think they would accept my RAMQ card and basically be the RAMQ that takes care of it. I would assume, but I don't actually like know for sure. Or rather, actually, I have a friend that did the opposite. They relocated from Ontario to Quebec in Montreal, and they had to register for the RAMQ, as in they couldn't get healthcare in Quebec until like they started registering with the RAMQ. But in the meantime, they had to like, go back and forth. They had to go back to Ontario to get their healthcare. But like, yeah, pretty much if I permanently relocated, I would have to eventually register for that province's health insurance, if that answers your question.
Interesting. I guess, I mean, how does Canada, I'm sorry, I'm completely ignorant of like how it actually works. Is it like a federalist system, kind of like where each of the provinces have their own, because in the United States, we are all our own sovereign governments in each of the states, and then there's an overarching federal government. That's what federalism is. So I guess is that how it is, and each of these provinces are like like sovereign, and then there's like an overarching healthcare law that was passed that now all of the provinces have to give this stuff.
Yeah, I think it's pretty much a very similar system. I mean, we also have a federal government as well, but and it will basically it will depend on, let's say, the particular whatever field, or rather like, let's say, healthcare that is taken care of by each individual province or territory, just as like Quebec, also education as well. Each province basically manages its own education system, but then the federal government provides some funding for that, as in each province gets what they call, if I remember correctly, a health transfer, as in you'll get X amount of money allocated to the province, and that is devoted to, healthcare expenses from the federal government. So it's like part of the funding for the healthcare in the provinces, or actually a major portion of the funding, is coming from the funding from the federal government, but then the province handles it or manages it.
What if the province is like, we're not doing it anymore? Nothing. We're putting it to a vote, and we're all libertarians here, So like, is there a federal like healthcare like that Canada like offers? Because that's what would happen in the United States. So the states were actually given money, the option to actually take money during Obama, we were talking about hundreds of billions of dollars in order to like expand their coverage, which is the Medicaid expansion that is happening and being revoked right now, actually. So we expanded Medicaid and said, hey, we need all these people to be insurance covered by, and we want the states to run these exchanges, and the states run these basically healthcare exchanges where private companies can come and offer insurance on these, like kind of like a marketplace. I have an idea, but then there are still Republican states that were like, no, we're not going to do this. We would never want to do this. And we're denying that money from the federal government. And then in those states, then people had to go to the federal exchanges, and the federal exchanges. And that's what's happening right now. And that's why people are having like 300 to 400% increases in healthcare rates because of this nonsense. So is there like a federal system, like a federal Canadian?
So I have to think. I have to dig up the files of Canadian politics in my brain. I don't think the provinces can opt out. I believe it's sort of like built of like they have to have like a public healthcare system, and they can't like not have it. This is not to say that we don't have but here, but we do have some aspects of private healthcare here in Quebec, where we do have like a semi-private system, or there's some aspects that are privatized. But I believe it's like the provinces are forced to have public healthcare.
Yeah, so I guess I just looked up like the Wikipedia. So the Canada Health Act of 1984, the statute establishes the framework for federal financial contributions to the provincial and territorial healthcare insurance programs under the Canada Health Transfer. With that said, the CHA deals only with how the system is financed. Under the constitutional division of powers and the Canadian federalism, adherence to the Canada Health Act conditions is voluntary on the part of the provinces and territories. The federal government cannot compel the provinces to comply with the act. However, if a province does not comply with the terms, it would not receive the federal financial contribution to healthcare. Those fiscal levers have helped to ensure a relatively consistent level of coverage across the country. So that could be that could be your future constitutional crisis right there.
No, yeah, you are correct. As in, so yeah, that sounds about more accurate than what I said, or rather, that is accurate, or as opposed to what I said.
It's one of those things where in the Wikipedia they're like, well, why wouldn't the province accept this money from the federal government? Like, why wouldn't you do it? And then Republicans in the United States are just eating as much glue as possible.
Yeah. But actually, think what Corey had previously described with the different provinces. Mm-hmm. So I'm imagining like, a scenario where, we are single payer is on the table, right? But we just need that little extra push. I imagine that what that would have to include, if I was part of the negotiating table, this is the last thing I would want to give up, is like state control. But like it's something I'd be actually willing to give in, because in that scenario, then it's like it's mirroring what we're seeing with Medicare, right? And that like the different states run their own Medicare system, right? Like, and they can start deciding like what they will and wouldn't cover, right? What this does is unfortunately, in the southern states, it gives them the ability to be as awful as they desperately want to be, right? But one, it gets the system in place, right? And improvements can be made afterwards. And two, it still gives people the option, and I know this is not like the best option, but the actual option to move, right? To get better healthcare, right? It's not like to move in our current system, to move to hopefully get a good job that will hopefully pay enough or provide healthcare for you. You're moving, right? And you will get that healthcare. And then after that, you'll have to, get another job. But that you're not reliant on that job, whatever you manage to get your hands on, for your healthcare. That healthcare is provided for you once you move to that state, right? And so I think that would be a great, like not a great, but like it would be a compromise that could help get something such a thing passed. And again, once that happens, you're now in the realm of politics where there's a fight to be had, right? Because especially if your local in your local state, people are seeing everyone else in other states like get this healthcare that they're not getting, right?
Yeah.
Because you degrade it somehow. This wouldn't help like so much like marginalized groups, right? It wouldn't help again for our trans brothers and sisters. In this case, they could take away trans healthcare in like freaking Florida, right? And so they could do that, but you would have the option to get it somewhere, you know. Yeah.
From the Wikipedia, this is onto your point. Establishing the principle of universal single-payer healthcare, the acts. This is the Canadian Health Act in 1984. The basic requirement is universality. So this would be maybe something that we could adopt. To qualify for federal funding, provinces and territories must provide universal coverage of all, quote, insured health services for all, quote, insured persons. Insured health services include hospital services, physician services, surgical, dental services provided to insured persons if they are not covered by any other program. Insured persons means anyone who is a resident in a province or territory and lawfully entitled to be or to remain in Canada. So that would be the universal thing that could include maybe an ideologically hot or toxic group that people.
I don't know if that would though. So like, and I don't know obviously I don't know the details to the system that our Canadian brothers and sisters are using, but like what that reads to me, and I could be incorrect, but what that reads to me is that okay, we have a basic level of healthcare, and that has to apply to everyone, right? And so like prostate checkups, we're gonna get our prostate checkups, we're gonna get our general doctor's checkup, whatever that may be, right? But that's like across the board healthcare.
Mm-hmm.
Right. But like I could see the argument being, well, trans healthcare is something extra and above, right? And we don't all use that. That's not a useful thing, right? And so that
that's exactly.
So that we wouldn't provide. Or maybe they'd even, I could even see them doing the opposite, saying, well, of course we can't provide this, right? Because not everyone uses these healthcare services, right? And so now we create a special class who gets extra healthcare. I can imagine them making that argument in court.
Yeah.
Yeah.
Yeah, exactly. It seems like, unfortunately, this Healthcare Act is written in good faith, and there isn't a toxic political element like Trump that has tried its worst in order to take apart in every single string and cut away at every single
Or
string.
looking for any loophole that they can exploit.
Exactly. Yeah. Oh, there's no legal requirement for us to do this, so that means that we don't have to do anything, kind of thing, which they're pushing for. And so yeah, I mean, it'd actually be kind of interesting to see how much Canada solidifies in law kind of the stuff that the United States kind of had a handshake agreement, with, and tries to kind of like take some of this stuff, because I mean the numbers, guys, are unbelievable. So Canada's healthcare spending per capita is 60% of the United States. 60% is less than 60%. So imagine
we have overall better outcomes. Well, coming to certain things, like I think infant mortality and all that stuff, and maternal mortality.
Yeah,
and life expectancy as well.
Just imagine the in the United States, where we are having now in January 2026, the year of our Darwin, that are having to deal with this stuff, and it's like, I don't know, man. It's just wild. It's crazy.
And and you brought up a good hypothetical in terms of like, what if a province just turns all libertarian and they want to refuse like the health transfer? It's like, well, no, we don't want that money. That's a good hypothetical. Like, it never really crossed my mind, because like, well, it's almost like a given, as in I guess I take the healthcare system for granted. Like, I just assume it's always going to be there, and there's like massive public support for it that will pretty much always be there, or at least as far as I can but like there's not there, based off of like what you read, there's nothing stopping a province from doing that. Of like, well, actually, no, keep your federal money. We're just going to whatever, do our own thing type of.
Yeah, exactly. So yeah, it's man, it's pretty wild. I just worry. I guess I'm just in a fever dream of like in a world where Trump is the head of our universal healthcare system, and now he's deciding who, Democrats don't in major cities don't get healthcare because you're exposing yourself to X, I don't know, whatever that is, whatever he decides or something like that. It's like, oh, something that you're or you just there's a bunch of different ways, and I don't know. I the more like the Fed is like probably the most technocratic part of the United States government without being a part of the United States government, right? It's not technically, but it's an independent technocratic institution. So that's what I was.
Reserve Bank. Yep. Mm-hmm.
Yeah. So, but in there, and if you like, honestly, I'd watch him before he leaves, but Jerome Powell, like his addresses and stuff, and they talk about graphs and data, and you're like, wow, this guy actually, they actually are talking about, a technocratic solution. I don't know what the rings or the levers that they pull is the unemployment rate and inflation. I don't know what the levers of a independent third party would do, in a healthcare scenario, but it'd be interesting.
Yeah. I think the question that you've asked was like really good. Because it's something that, people on my side of the political spectrum, progressives and leftists like have to actually tackle, right? It's a legitimate question.
The actual
like, yeah. How does this work, and how do we protect this? Well, honestly, like, and I don't think it's a very satisfying answer. But like, I think that this is the push and pull of politics. I think that one, we can see right now they already have effect, even in our supposed free market system. Like government can make things worse, right? Government policy can make it better or make it worse, right? Can make it easier, or can make it infinitely more complex. So it's not like we aren't living in a system where there isn't government interference. In fact, there's a lot of government interference into like the insurance policy space, right? That's like a ton. It's one of the most regulated areas, period, industries, period, right? So we're already there. It's just, hey, do you want these parasites, these vampires, to be sucking off, right, like a portion of these healthcare costs for their own benefit, and then deciding, after the fact, you fighting with them to get your health benefits that you paid for. I'm sure members of your audience have already dealt with this, right? Or had a fan member or someone who's dealt with this, where like, you're sick, and then at the same time as you're sick and trying to get yourself better, work your way through the system, which is in itself a difficult thing. But also you're fighting the insurance companies, right? Also, they're giving you like wrong information. They're saying this is covered, right? And you move forward thinking this is covered, but then this is not covered. And then you have like a $5,000 bill on your hand that you weren't expecting and you can't afford, right? Like this is the system we have now. So the system that I'm proposing is not a perfect system. Dr. Greg helped show why it's not a perfect system. But I think it's better. Like my overall calculation is that it is much better. Yeah,
for sure. I think it is
and just
too. And
from my anecdotal, or rather from what I've heard from other people that have dealt with the American healthcare system, although I understand, or let's say vary state by state, but what seems to be so again, and I guess contrasting it with my own experience, it seems like, so if you have a chronic illness and like you require some sort of specialty medication, it seems like for some people just dealing with insurance and all the hoops you have to jump through is like a full-time thing, or like already like draining both mentally and psychologically in and of itself, of like you're trying to manage this illness and then you have to now navigate the insurance aspect as well, or like now you have to advocate for yourself as much as possible and jump through all the hoops to get the get the access to the either healthcare or medication that you need. As opposed to for myself, at least for me, again, I'm sure it happens to people here, but I've never had to deal with that. Other than like, my doctor filing some paperwork and then I get approved for medication.
I used to work at a hospital, a major hospital in the United States, and like a well-known hospital too. But I used to work there. Specifically, where I worked was I did IT, so not part of the medical field or anything. But I did work for the social work department. That department, right? Like what those social workers were doing, one was just like giving resources to different patients that needed it, right? Like a lot of poor patients come in, they need different resources, they help them navigate like the system a little bit, right? And then just like help them like, okay, well, you're going to get discharged, these are some things that might be useful to you, that kind of stuff, right? The other thing they did was help them like help fight with the insurance companies, right? Like it will help like try to deal with these claims. They will be on the phone. I'd be hearing them on the phone with insurance companies, like battling, right? Like this was the department, and this is not even the only part of it. Like I had another person in that department, or two people really. They did was deal with denials, because we send out a claim, right, as a hospital, but then like there'd just be a regular procession of denials that would come in. And I remember like, because at least back then they were doing it through like almost entirely paper. There's so much paper wasted. Oh my God, right? But like reams of these paper coming in. And then there's some cases like individual patients who have like long medical histories, and you have to print all that. And it's just like stacks and stacks. Sometimes like many cardboard boxes full for one patient. Right. And that's just a denial. And then you have to go back and forth with them, send them out, and you have to send each company once like your claim delivered in a certain way, right? It's not like a universal way of like fighting the claim. You have to like for each particular company like do exactly the way they like it. If they don't like it, then they'll like reject it again. Do the process all over again, right? You did it, you packaged it right without like a yellow bow on top, right? We demand, you gave us a green bow. We don't like that. So that's the thing that was happening, and it was just like this massive effort all the time fighting it, right? Like not just like the patients fight that, but the hospitals themselves, because this is the way they get paid. They have to do this, right? And so there was just an endless fight. And then on top of that, you have like software, right? There's like in the background, in case you don't know, there's software that these hospitals use, right, to like try to head these things off of the pass, right? These utilization software. Like there's a whole infrastructure built with just to fight the insurance companies. Like this is the thing. This is what single payer would eliminate, would streamline. And so much of this is like opaque to the individual, and that's when things are going right. Okay, that's when it's opaque. When it's really bad, that's when it's like your problem, right? And maybe the hospital's not really fighting it for you on their end, right? And you really need that healthcare at that point in time, or maybe this bill is coming at a point where you really can't freaking afford it. Yeah, then it's very transparent to you, and that's not a good thing. But yeah, in the background, there's just like so many like there's like a mechanical industry, right? All these levers being pulled to like make this happen, to just get them to pay what, like, again, these are paying customers, right? What we're talking about, what I was just discussing is not like individuals coming into the emergency department and like not having any health care, right? That's a separate issue. These are all paying customers to a health insurance that are just being regularly denied. That's what they were dealing with. Crazy.
Yeah, and it's such a good illustration, man, of like, for the customer, your lived experience wouldn't be any different if you had a single payer private provider system, right? It would just be single payer, means that there's only one payer, which is the government, and then a private provider. You could have a public provider, you could have a private provider system. Public provider would be that basically the hospitals and the physicians all work for the government. The private provider would be these hospitals, and these private practices are individual companies that are, and the profits are go to those people. You could have different ways of administering the healthcare, but at the end of the day, pretty much universally known and amongst developed nations is that a single payer is the main thing. So you have, and as a customer, you're going in there and you're getting the healthcare administered to you, and the only difference is that you're not going in there having to say, hey, this is what my insurance stuff is, this is my insurance stuff. Like, you're going to the doctor, they're giving you healthcare, and that's it. Like that's it. All of, and then the physician, after the work has been done, they just bill the government, and they already know where to bill. They already know who to say, who to talk to. They already know all that kind of stuff. So, like, as a customer or as a patient, your reality actually gets a lot more simplified. You don't have to worry about, like, at the point of administration, maybe there's a copay, maybe you have to pay like something, somewhere, but it's not like what's happening now.
Yeah, that's sort of what I was trying to just to speak to that, of like, as someone who's had whatever a dozen trips to the ER, but like, as you just alluded to, again, I'm sure it happens here, but like to some extent, but like, yeah, of all my ER trips, I've never had to like worry about billing, or like, is my insurance going to cover it, because like, well, it's the public healthcare. Just like having that in the back of your mind of like, I'll have to deal with insurance now, just seems like an extra layer of stress when you're like in the emergency room, which is like not needed, I don't think, at that point.
100%. Yeah, it's ridiculous. And like, and exactly right. Just having to deal with that extra stress is wild. I don't know. I guess to pivot onto like kind of recent things with the measles outbreaks and everything like that. I mean, it's wild to think about. I mean, how in Canada, with everything, you guys losing your measles protective status. So basically, if you have an active measles outbreak for more than a year, you lose like your status as a country to say that measles isn't spreading here, because like by definition
we can no longer put it on our CV, eliminated measles.
So it is, but rightly so. It went up and then it's gone down, and you guys are on that tail end, that second tail, but it's technically still there in the in British Columbia. I think it's still kind of like surging a little bit, so that's kind of the reason why. Yeah. So but it's emanated out from like the kind of the center. I mean, how I'm so curious, like how people are kind of like talking about unvaccinated people, because I looked at the Ontario province's epidemiological report, and 97% of the cases are unvaccinated people. And it's not like, and we're not talking about cases in the center of the cities, right? We're talking about the more rural outskirts of like the more conservative areas that have the higher unvaccinated cases that are driving these numbers. So I'm just curious, Corey, like how are people talking about it in Canada, like in the media? Are people like voicing these people's like, I mean, what are people saying?
Well, I don't. So, at least in my circles, no one's unfortunately really talking about it. That might just be a reflection of the people that are around me. And like, aside from just covering like just the factual basis of like there's a measles outbreak, like there, as at least from what I can tell, there's no greater conversation of like, well, how do you deal with the unvaccinated in a country that has a public healthcare system, right? Because like, and it's like there's the philosophical question of like, this is almost certainly preventable, right? With enough vaccination rates, and like I've been vaccinated for measles multiple times, or got the MMR vaccine multiple times, no charge. And so it's like, should these people there's no conversation from what I can tell. I'm not saying that the conversation necessarily has to be had, but there's no conversation about, should these people like receive the healthcare because it's sort of a self-inflicted type of situation. Because it's like, well, regardless, this is also my mentality of like, even though it's a self-inflicted wound or illness, they still deserve the right to healthcare type of thing. And I think that's pretty much like the mentality of most Canadians. Like, even though it's the unfortunate result of their own choices and poor choices, they still deserve the right to health care. And I think that's one of the reasons probably why the conversation isn't happening. We just, I guess, see it as a sort of we do see it essentially as a right, regardless of the poor choices aspect.
What is the healthcare, like, what is the friction for immunization in Canada? I guess because I thought I looked it up and it was like schools similar to the United States, but I'm not 100% sure on that. It was like,
yeah, I know for sure some vaccines are mandatory to get into school, if I remember correctly. I think it's pretty much a similar system in the United States, unless you have some sort of like actual legitimate exemption.
Okay.
What's a legitimate exemption?
Well, yeah, I know that gets exploited. The religious exemption, just like therapy animals or therapy dogs. Everyone has anxiety, so they can get their therapy animal on the plane.
Yeah, you're right. So I looked up the Ontario Immunization School Pupils Act. Requires students to be vaccinated: measles, mumps, polio, tetanus, diphtheria, pertussis, meningococcal, chickenpox. They can, and the enforcement: the student must provide proof to their local public health unit, otherwise they can be suspended. Exemptions: parents can claim medical, religious, or conscientious objections by completing forms in educational sessions. So that's I'm really curious if there is a social push in Canada to say, well, what the heck? These guys are like, obviously they're the religious exemption is a farce, right? And we are, or whatever, especially that last one, conscientious objections. So that's just like someone that's just anti-vax, basically. So
the vibe feels off. I don't want it.
Yeah, exactly. And that's not how public health works. So now these people, guess what? They caused a huge pandemic. Epidemic, of outbreak of this stuff.
And they are a strain on the healthcare system. I mean, there's many things straining our healthcare system, but there are articles here today locally in Quebec, and I think it holds true for other provinces. I don't know if it's the same, but basically, we appear to be having a bad flu season for a variety of reasons. But then combined here, so our ERs are flooded because it's a bad flu season, and also it's winter, and as a result of winter, we have understandably more people falling and whatever, breaking a bone or breaking their hip type of thing.
Here in Colorado, I was just looking at a thing that's like record high, double the amount of flu cases in the emergency room because of what's going on.
Yeah. And I know that the flu vaccine is not 100% effective, and there seems to be questions about how there are other potentially less effectiveness this year as a result of maybe getting the strain not quite correct or optimized. But yeah, basically from what I can tell, there's no larger conversation happening in terms of like, well, yeah, what do we do with people that are like they're a strain on the system, but like the source of strain is largely preventable.
That's interesting. I'm really surprised that there isn't like a national kind of like discussion being had about that, because it's a pretty big deal. Like the amount of like you guys are having, I mean, I thought it was like a couple thousand, which is 2,500 cases or something. I mean, I'm going from memory off the epidemiological report that I read 2 months ago, but which is like where we are at in the United States, like currently, but we are going like hockey stick up, so that's kind of the
I appreciate
problem.
the hockey stick reference as a Canadian.
Yeah, nice, eh? But yeah, yeah, man, that's really interesting. I guess, is healthcare like normally like talked about in politics, or is it?
No, well, yes, absolutely. Healthcare is always a top issue, if not the top issue, no matter what.
Interesting.
But like, I think one of the reasons why that conversation doesn't happen, because it's like there's a reason. I think this is one of the talking points that people use to push back against having a public healthcare system, because if you open the door to this aspect of, well, if you are not vaccinated, okay, and you get the condition that you have the self-inflicted condition, and if you have that conversation, that opens the door of like, well, what do you do for people that, let's say, because there are certain aspects of, cardiovascular disease,
Mhm.
obesity, type 2
Exactly.
diabetes, et cetera, et cetera. And so understand, they think that, that's a tough conversation to have. And so if you have that conversation about the vaccinated, that potentially opens the door to other preventable or somewhat preventable conditions.
Yeah, because I mean, it's like, dude, I mean, in the United States, you get denied healthcare services if you are unvaccinated. Like if you or you're unvaccinated, you're not going to get a heart transplant. Yeah,
Well, I
it's
think the
just
same thing. I don't know for sure. Don't call me. I would assume the same thing holds true here, but like that's a totally different like sort of situation in terms of like you have to meet the criteria for a
yeah,
transplant type of thing.
yeah, dude. You got to make sure that we are eliminating as many variables as possible. So that this heart transplant, which is very valuable, is going to go into someone that can fully accept it. And if your body is tenuous, the healthcare status, and you have all these added variables, it's like, well, who cares? Nobody is going to go to the next person because you haven't taken care of yourself enough in order to take kind of this seriously. Thank you, Call Me Bob. So it's it's I don't know. I mean, it is. I think that there is a vaccines are so cut and dry, it's so obvious. I do think, and it is an interesting point, and to prime your point, like these are the conversations that we should be having as a country, right? These are exactly what these are what the healthcare debate should be about. Like, where do we draw this line? Like, what, Ozempic and stuff, 60% of the United States morbidly obese. Where do we fund this? How do we fund this? How do we help people get this so that we can decrease our healthcare costs? How could that kind of stuff? Like,
and also like Ozempic is a really interesting one, because should we be providing this? Like, is that a thing that should be on like the schedule, right? So, like, God, there's such a nuanced discussion of Ozempic, because a lot of people, and I'm not one of these individuals, I'm just explaining their point of view, would say that, like, well, individuals who are obese, right, or overweight, these individuals are lazy, and they just like should be exercising more. And why are you raising up my insurance rates for you to be paying for this, like, a piece of medication, right? Like, and so, like, if this was in a single payer system, there'd be a lot of fight, because like something that would happen, again, back to the previous conversation, is that not only for marginalized groups, but also for like moralized uh conditions, right? Like, STDs are moralized conditions. People attach um of like a moral weight, a moral value. Like, you are less than if you got an STD, right? Because you're a slut or whatever the hell, right? But also, like, for being overweight, hey, it's a moral failing. This is the mindset in the United States, that you happen to be overweight, and so it's not our fault, not our problem. That's your problem. So that's a big thing. But also, Ozempic, right? Like, do we actually want more people on this, right? For some a portion of the population, absolutely, right? I understand that there's some people, like, they truly desperately need this, but it's being provided to a lot of people, and not the side effects. Yeah, the side effects are quite serious for Ozempic, right? Like, I've heard serious, like a mass, like loss of bone mass, bone density, for people who've been on, and even for just a short while, right? Like, these things are like quite serious. So in a single payer healthcare, let's say like the money we're turning on like the money spigot, right? Like would we want everyone who could potentially get some sort of benefit on this medication? Would that be a good outcome, right? If they simply requested it, or would we want to like try to like limit something like that? Like I think it's a tough question.
Yeah, and I think there's an equal conversation or somewhat equal conversation to be had here in Canada of like doing the cost benefit analysis of like, well, what if instead of treating all the consequences of, let's say, someone being overweight, potentially type 2 diabetes, metabolic syndrome, certain cardiovascular diseases, whatever, stroke, et cetera, et cetera. What if, as a preventive, is it actually cheaper to just have everyone who's overweight or obese on Ozempic here in Canada? It will actually will that result in overall cost savings in the long run, as opposed to treating the type 2 diabetes or treating the cardiovascular disease or cancer, et cetera, et cetera. Yeah, there's a nuanced conversation to have.
Your kids are really freaking cute, Dr. Craig. Just got to put that
Thank
out
you.
there.
We also, additional limb surgery for Barbies should be free of cost.
By a qualified specialist.
By a qualified specialist. Yeah,
There
that's
you
what
go.
you're being
There
Dr.
you
Craig in.
I do, and you can see the political football kind of happening that we were talking about with like Medicaid not covering Ozempic and things like that. So I think Prime, I think you're using it too quickly is going to cause some type of like bone density problems, but also the side effects basically of being obese is the comorbidity of like every other disease. So I think that in the long term, I think the side effects are okay, and I think that's okay. For me, my hot thing is like, honestly, I think that we should be giving it to kids so that they don't grow up and aren't morbidly obese into adulthood. I think that's like the real crime, that we are allowing these people that lifelong chronic obesity really starts at the child's, and there's morbidly obese kids that you'd be surprised looking and it's wild to me, and these poor kids basically are going to be growing up into a world that is, they're going to be living shorter lives. They're going to be living with more disease. So I don't know. I think that we should actually be opening it up to more people earlier, younger.
I don't disagree. I'm just curious how conservative thinks about this, because there's obviously a lot of rhetoric on the conservative side about certain aspects of healthcare for kids. Are they on board with Ozempic or weight management healthcare for kids? Is that something, because it seems like a lot of talking points is like unless it's absolutely like life-saving type of thing, no healthcare for children.
I'm a bit more skeptical. Yeah, I'm a bit more skeptical of this idea of Ozempic for kids. I've never heard anyone put that out there, first of all. So I'm like just like trying to grapple with this. So first of all, I'm certainly not a doctor. These two would have a better idea than I do. Like they have they're at least within the ballpark of the field that could have a better sense of what this would look like. But like one, I always skeptical and cautious about putting kids on medication in general, unless like they absolutely need it, right? And the case would be here, like, well, you might absolutely need it for there are weight problems, but like, here's a problem with just like the over medication like mindset within the United States, right? Like why are kids, like children, morbidly obese, right? Now it could be a comorbidity for something else, right? That's obviously a possibility, but like for children mostly that's going to be a lifestyle thing, right? Like that seems like this would be the best time to intervene and to put healthy habits rather than like like eating habits, lifestyle habits, rather than relying on a pill to do that and then not actually teaching them to be better later on.
I think, dude, I think like I would dramatically restructure, elementary, middle, and high school programs. It would be a lot more teaching, like bringing back home ec, bringing back how to cook, bringing up like
home ec is no longer a thing now.
no, it's completely gone. No, like we don't have any, like you teaching people how to cook, how to, it'd be a lot more active, than what we're doing right now. I think and you're talking, Prime, about like the institutional problems that have led to this. We have food deserts. We have, institutional, racist policies that are, causing a lot of this. Absolutely. And I think like we definitely should address those, during this kind of like time. But, the fact that there's like pharmacological interventions that can improve quality of life, I think that it's kind of unethical not to provide those. Yeah, exactly, Helen. Yeah. Financial literacy, how to pay taxes, like, credit cards, like why it's bad to do minimum payments on credit cards, also student loans, right? What student loans are, what we're going to have to do, horticulture, how to garden, make some food. I think actually during the high school, you should actually have to, end the life of and prepare meat. I think that you should, like
Interesting.
you should absolutely know where your food comes from, understand what the process is in order to make that slab of meat in your grocery store, and you should be connected to that process. You should do the gun thing that made that animal unalive, like personally.
You mean you want like one of those air guns?
Every single person should know what it feels like in order to end it. Absolutely. Like,
But what if they're a conscientious objector?
You can absolutely. That's okay if you're a vegetarian or something. Then it's okay. But I think that you should absolutely be there in the process, know what it's happening. And
yeah, I don't disagree.
I think that you have a lot of people obviously going vegetarian after this. I think, by the way, that 90% of people would be vegetarian if they had to, do the deed themselves. And
I don't disagree.
And they would have to.
I definitely disagree with that, Hun. Of course, that can't be the case, because then previously, like in centuries past, when we were very much connected to our food, right?
Mm-hmm.
People had a much better idea. They watched it and they partook in it, and they still chose meat. Come on. Like the one, like people, like we've gone soft now. I agree, right? Our society in general, because we aren't connected to it, right? And so I think people are a lot more squeamish about all of these things, right? Like the idea, I'm sure it sounds horrid to quite a few people listening to this, right? I'm reminded by my mother. My mother actually had to like kill chickens and like prepare chickens in her youth, which at first like seemed like, oh man, that sounds like pretty intense to me, right? But she's like, yeah, I was like, not a big deal, right? Like we just did it. Like she was like literally like 6 or 7 or something doing this, right?
Mm-hmm.
So yes, I think we're soft here in America, and I do agree that there would be an uptick in veganism or vegetarianism, but like humans have managed this for so many years, right? Like we're not new to this process of killing animals for food, and we did that.
I don't. Well,
how many of those people were actually like doing the deed? I guess I don't know. I mean, I that's honestly a really good point, Prime. I mean, I think obviously it did exist, and it's had that exist before, but I don't know if each person was like doing the deed itself, and that was just in their culture of like having to deal with it. But I don't know. I think it's a lot more gruesome than a lot of people understand.
But even then, people would saw like it wasn't so far away, because like now our farms, our ranches are very far away. I live in the city. I don't see any of that. I just get the end process. To your point, right? But
Mhm.
before, you actually would like be in contact with like the butcher, even if that wasn't your particular job, right?
Yeah.
You'd be in contact with the butcher. You might see them actually doing it, right? We lived in much smaller communities, and we had a better idea of these things. Our food systems weren't at all disconnected, and so like people were aware of like what goes into it, the brutality. I think things are a bit different with the factory farms, like the way they operate.
Yeah, that's what I was gonna say.
Yeah,
Like,
but
I
still,
don't
at the
think
very
people have.
least, like people manage to like still eat meat, knowing what that looked like. But sorry, go ahead, Corey.
Mhm.
I was just gonna say, like, yeah, with the factory farming aspect, like, I don't disagree that probably there's more people that are more amenable to, like, whatever, shooting a bow and arrow into an animal. But I don't
Mhm.
know that they're so on board with the factory farming aspect and all the stuff that goes into that. Yeah.
Exactly. Yeah, I think also like animals was such an important part of like human nutrition when it was more scarce. I think like you can get non-animal meat or non-animal nutrition a lot more readily now, that I think that people would like if they had to, if the only meat products that they could get was from their own hand, they would just be like, okay, I'll just get like the easily readily available stuff that's just instant gratification. I think this is a hypothetical world that doesn't exist and that never would exist, right? But like, I'm just saying that I think that people in schools should be connected to the process of where food comes from. That
I'm not opposed.
I
fundamental
agree
thing.
wholeheartedly with that. Yeah.
Yeah.
And they should bring back home ec. I didn't know that was essentially phased out.
I know,
I'm sure
dude. Isn't
maybe
that
it's
wild?
very safe, but I remember I had to like make a sweater in home ec. I had to make some muffins and learn some basic cooking skills.
Mm.
Yeah, I didn't make a sweater. That would have been interesting. But yeah, basic cooking skills.
Well, I made what resembled it. Wasn't a good sweater. I don't think anybody wore it, but I had
Okay.
to learn some steps in the process of making a sweater. I had to operating a sewing machine and all that stuff.
Yeah,
Cool.
my home ec was like really basic. So all the only thing I remember was like some like basic cooking skills, and we had like you had to make like a tortilla thing, right, for a taco. And we did that. That was pretty much. I think that's the only. We barely did anything in that home ec class.
And in my woodworking
unfortunately.
class, I had to make a cutting board, which was not that.
Oh, that's cool, dude. Yeah, we didn't have. I mean, we had woodworking, but I didn't do it. I wish. Oh, aeronautical. Thank you, brother. Thank you, man. Appreciate you. Yeah, dude. I had photography, which was like a.
I definitely didn't have anything like that.
And we had to like we had a black room that we went in and like did our own thing. And so that was cool, which is kind of like funny, that's completely dead now. as a thing, even more so than woodworking, I feel like. But like actually putting it in the acids and like putting the photos up and letting it dry, I think that's completely dead.
Yeah, I wish. That sounds like fun. I did join a photography club in middle school, but like it was just like one teacher, and he was like, he's got like a fancy camera, and we just like walk around like the neighborhood around the school, and we'd like take turns using his camera to take pictures, but we weren't like developing or anything like that. Like didn't have like a black room or something. That would have been really fun to do. But yeah, we didn't actually get much. Yeah, unfortunately, just so little. It's like enrichment, like like after school enrichment, at least for my areas.
Yeah, I feel like that's like a good way of like structuring school, and that at least in your elementary and your high school years of kind of like how the world works. And that, I mean, that's kind of like what the civics idea is too, right? Having civics and how things exist and how government works, versus I don't know, like job training, not necessarily big on that. Maybe more job training more so in the college level, like this is what jobs actually are. But on the high school level and below, I feel like it should be all about like how the world works.
Did you have like some social studies class in your school, like learning about the religions and all that stuff?
I did.
Oh, okay. Yeah, so I did. I'm just curious if it's still like a thing. I have no idea.
Yeah, I mean, that's good. It's a good question. How much has been cut out of American public schools? Yeah, in favor of a testing regime, right? Or just because there's funding cuts and these things are extraneous to, arithmetic and reading and all that stuff, and so slowly we just like we get rid of all this enrichment that really like adds to like a person's well-roundedness and like helps people decide like where they want to go. What do I do? Oh, maybe I like working with my hands, right? And so this might be the path for me. But you don't get that. You don't really know like like what your options are. It's really sad. It's really unfortunate.
I literally had the class was called like moral and religious education. I don't know if it's still around or not, but like it was called MRE, short for moral and religious education. Just like pretty much learning about the religions and the moral aspects as well.
I think that'd be cool. I mean, we just didn't have anything. It's, I don't know, man. I feel like there's so much money that's being cut on everything for high schools, and it's just kind of like getting you prepared for college, and getting the test scores in the United States. So there's such an insane failure. I mean, the reading levels are dropping, not hugely. I was actually really surprised. My friend, we looked over the science and English attainment. It's kind of like flatlined for the last like 15, 20 years in the United States. It's trended down a little bit in the last like 10 years, but it's not a huge drop. But you'd be surprised, man. My second grader right now, he's 8 years old and he's reading at a 7th grade level, which is the national average. So I'm like, it's kind of like, it's just wild, man.
No, hopefully he doesn't plateau right there.
Dude, he loves reading. We actually pay them to read, so they get paid 10 cents a page to read. So he's like going through.
That's like $100 Canadian. I want.
It's the other way, man. Our dollar is plummeting, man. We are the.
I think your dollar's still way stronger than ours. I'm pretty sure. Right. Like, last I checked, $1 US dollar. That's the equivalent of like $1.30 or $1.40 here in Canada.
Oh, wow. Yeah. But yeah, he thinks it's a racket. He thinks that I always joke like, man, you're gonna make us poor like just by reading. So. They're all 18 months apart. So all my kids are from 8 to 2, 18 months apart right now. So,
of the data that you saw, if you recall, like that sort of like a dip in like the reading levels. Do you know like roughly approximately when that started? I'm curious, like if it started like let's say in 2020, with the pandemic and online learning stuff like that.
It was about it's like
and FYI, it's $1.37 Canadian. For Windows, the regular calculator app, it gives you a bunch of functions. One of them is currency converter. Like nice. Your regular, it's like actually pretty cool. Sorry, go ahead.
Yeah, but yeah, man, I don't know. I think like, but yeah, this is a hack. If you want parents out there, pay your kids 10 cents a page. I'm telling you, for like a 300-page book, it's $30. And they get, it's like chore money, you know what I mean? That they can go out and but now my 8-year-old like loves to read. He's like, during the summer, he was just like chewing through these chapter books. That's
I have to ask, how do you know he's reading all the pages?
I talked to him.
Is it self-report or?
Yeah.
I read this 500-page book.
No, exactly. No, he gets into it. He loves it. He loves talking to us about it. So he does it a lot. But the decline was like around like 2015, 2016. Let's check it out.
Okay.
It was the national like levels of all the tests and stuff. But it's
I was just thinking that maybe the pandemic had an effect of like online learning and all that stuff.
It decreased, and it's like hasn't come up again. All right, let's bring it up. National reading level scores USA. But we're having just a really bad. Our schools in the United States are really poor performing, and my friends. It was funny, in 2021, I met him playing World of Warcraft, and he was a middle school teacher for math. And I was like, yeah, dude, like, I'm trying to do science education. Like, I think it'd be cool, and a science communication. like getting people involved and all this kind of stuff. And he was like, bro, they can't read. Like, what are you talking about? You're trying to like to communicate like science and like lofty things to them. Like they literally, like they can't do word problems. They don't have any reading comprehension. Like they just can't read. And I was like, what? Like, what do you mean? And yeah, it's really bad. Here, I'll put it in the chat, the StreamYard chat.
Yeah, because so as someone who's also I'm not an educator in a school, I'm a private educator. I tutor and teach students privately, but I have noticed something, and this might just be me being, I guess, older or whatnot, or I might be seeing things that are not actually there. But I do notice that there does appear to be, and like I don't say this as a complaint, more like I actually feel sorry for some of these students because the students that I teach, they're basically end of high school or beginning university, and so like they had a significant portion of the education during the pandemic, like pretty much like either like right smack in the middle of high school or like transitioning from elementary to high school, and like I see some of them, it's like things were not necessarily that ideally should have been taught, were not taught in high school. But I don't think that's the fault of necessarily the schools or the teacher. That might have just been like, the online learning aspect. And they have basically, it seems like they have a lot of catching up to do because they were shortchanged during the pandemic and all the online and virtual learning that I feel pretty sorry for them about.
So the grade 12, I don't know why they didn't actually get assessed in 2022, but the grade 8 and the grade 4 did. So grade 8 in 2020, so the middle schoolers going into high school. In 2022, the average reading score for an 8th grade student was 3 points lower than 2019, the previous assessment year, and not significantly different than the 1992. So basically, between 2019 to 1992 was kind of like pretty much in that same level, but then there's a significant decrease from 2019 to 2022. So it's in grade 4, same thing. Grade same thing. So I don't know. I don't know why. I don't know. It's just kind of like an interesting thing. You do see like a bunch of people kind of talking about it at the education level, educators, at least that is. But it's kind of like anecdotal, but this is kind of like a, actual stuff.
Well, and also anecdotally. So, Prime obviously knows Lactoid better than I do, but Lactoid is a lawyer, and according to him, and I'll take his word at face value, of like, as a lawyer, he's trained to pretty much treat jurors or assume that jurors have like a 5th grade reading level.
Yeah. There's actual real world applications for people not understanding what DNA or RNA is, and it's not just outside of a pandemic. And that's a good example, is like having to teach jurors like what DNA is, because they need to teach what PCR is, because that's how they're quantifying the differences and how they can know that this person is who they say they are, and forms of like DNA, DNA evidence, for example, for a crime scene.
Yeah, and if it is in fact true that your average juror has a 5th grade reading level, I wouldn't want to be part of that justice system, or at least I would not want a jury evaluating me or in charge of my fate.
Yeah, it is. I don't know when we, like in the United States, start like investing into public services more, right? Public services in regards to our schools and to our healthcare system. I mean, it's just kind of like a complete lack of due diligence, a complete lack of like patriotic care to look after one another. I don't know. I guess like, it was interesting. There's a Veritasium video talking about the technology behind making the best chips in the world, which is in one place, in one Denmark company, ASML, and they were talking about how like the birth of this technology was basically, from the United States, that they were so afraid of the Cold War that they were putting all this money into technology development and research and all that kind of stuff. But then after the Cold War ended, it was like, oh my gosh, we need to spin out this technology into companies so that we can actually utilize this technology and utilize this research and development that's happened. And then that kind of like, it changed hands, and then it went to Denmark. But I was like, man, maybe is that what the United States needs? Like, in order to have like a patriotic moment where we can invest into our institutions again, or believe in our institutions, some type of like another Cold War scenario. I don't know.
Or something to like rally around in terms of like, whatever, going back to the moon, or like, some sort of, space aspect, as opposed to like a private company, or like hoping SpaceX does something. It seems like, there was a lot of, well, I think it still holds true today, of like, I think regardless of the lack of trust in institutions, there's still a lot of public support for NASA. Seems like NASA's like one of the few institutions that people still believe in quite a bit. But it seems like, from what, correct me if I'm wrong, but I think the funding towards NASA is not so great, or is, I think, decreasing over time. But I could be totally wrong about that. I haven't looked into it.
No, I mean it has, as far as I know. I mean, like I have a big problem with this, and that we've outsourced space travel, such as it is, or the creation of space vehicles to private companies, and I don't have any problem with them entering the market. I think they should be able to put out a product if they want to enter in that field. That's great. Like if you can do it, if you can prove you can do it cheaper and all that, that's fantastic. The problem is that like SpaceX and Blue Origins, the way they're doing it is through government contracts, right? They're not actually just doing the work, like like coming up with a rocket themselves and proving they can do it better and cheaper. No, they're just taking taxpayer money, and then they use it to develop all these rockets, and especially SpaceX has done it in a poor fashion. But don't get me started on that one. But in any case, they rather than a NASA, which is a proven entity that has all these processes in place, and was actually, so Obama was the one who deregulated this and like moved it away from, like, he retired the space shuttle, right? But like NASA, if I'm remembering the timeline correctly, if I'm wrong, I do apologize. But NASA was in the middle of actually like trying to come up with a brand new 21st century space vehicle, and Obama ended that program. Not like NASA. Oh, they didn't think that maybe we should update our design, rather than like sticking with a venerable space shuttle for all that time. No, they actually are working on that. And then Obama ended that. And I think to our freaking detriment, because gave that leech to Elon Musk, like more government money to burn, but whatever.
Yeah, it doesn't seem like there was very large like government projects to like for the people to rally around or support. And if Obama was part of that, pretty much, I guess, crippling NASA, I don't think that's a good thing.
Yeah, that's a really bad thing. It's unfortunate. But again, like I don't have any problem with like private third-party entities coming in. It's just those third-party entities demand government contracts to do so, which I think is pretty interesting. Or in fact, like maybe all their funding is third-party contracts, and so that we put all that funding in, and then they keep the profits afterwards. Like, why not just do it ourselves then? But since we were doing, and since we literally developed the technology for space travel, that was America's. The government did that successfully. We know how to do this. We were the progenitors. We had that. But whatever. Sorry, that's just gonna enrage me.
No, as you should. Well, to me, it's to maybe also put it more in the science realm, or like as a somewhat similar analogy, and maybe Greg can also speak to this maybe better than I can, in terms of journal and funding towards, or rather, how we as taxpayers, not we because I'm not American, but essentially as American taxpayers, you essentially fund the journal system of like you do all the research, or researchers do the research. They publish it in journals, and it's a lot of basically public institutions that pay these subscriptions to these journals, and yet a lot of these journals, they're behind paywalls that the public can't access, right? Even though they're essentially pretty much just sending money is going essentially indirectly from the taxpayer to the journals, but the public can't access the journal articles, right?
Yeah, exactly. Yeah, it's a very weird scenario how like the gatekeeping happens in academia, where exactly right. It's by these nonprofit organizations like AAAS, for example, doing making science mag, but then they are funded by library fees and charging researchers in order to publish in their journals. It's a very odd relationship,
and they make crazy amounts of profit. If from last I looked like into the numbers, is like the profit margins, like it's like every industry would want these type of profit margins, if I remember the numbers correctly. Like
Don Amit from my chat, is there any branch of science that has more fraud than the medical science? I would say that would be definitely the holistic fraud, snake oil.
They would say that's medical, though, right? That would probably be like, I mean, that's actually it's underneath. Sorry, unless you're talking about not just medical, like taking supplements. If you're talking about like a jade gem, sticking that up your hoo-ha, right? Just that may be what you mean. But still, like I think,
no, they're definitely they're grifter. They're troll. Climate science would be right up there too. Yeah. It's
well, it's the things. And these things have something in common, because you're dealing with processes that are difficult for like the average person to measure, right? The medical body, the human body, right? And like the processes within that, it can be very difficult for humans to like understand cause and effect, right? Especially when you're sick in some awful way and you don't know how to deal with it, and maybe there aren't answers readily available within the traditional medical field. Well, then like it leaves the room wide open for grifters, right? We can sell you something, and maybe the placebo effect is a thing, right? That kicks in. And so people start making associations that, I felt slightly better today, so maybe this is working or whatever, right? Mm-hmm. So there's all that. But then in terms of climate change, right? Climate is like the biggest, like most complex, like natural system that we have like direct contact with, and like how does that work? I don't know. Scientists say one thing, but these other people, grifters, say a different thing, and so like since we can't oftentimes understand these processes so easily, right? That's a perfect place where for unscrupulous people to insert themselves.
Do you know what that person's or that user's basis was for making that claim of all this fraud in medical science or climate science, or just a bias?
He's like an anti-science, anti-troll. He's a troll. He's retweeting a bunch of stuff about like the climate science is wrong, and climate change is a hoax and all that kind of stuff. So they were definitely a troll.
So we see what happens. Like to my point, we see what the end result of that is. Yeah.
Well, hey, if they come on and talk about it, I'm more than happy to engage with that.
Yeah, come on and talk to us about it. Yeah.
Okay, I'll invite him on. I'll invite him. Don Amit, come on up, dude.
Yeah.
Put your money where your mouth is, or back up your claims.
Yeah, 20,000 followers on X. There you go.
Well, but 19.9 thousand are probably bots.
I know, right? Jeez, it's so wild, man. It's so interesting how. Oh, thank you, 5 minutes. Thank you. Oh, they're coming back. They're coming in. I don't know. We'll see.
Did you any of you happen to read? Not that I necessarily expected you to, but the one of the articles that I posted about Trump and his potential like health issues or some of the things that he does to manage his health.
I did, man. I think. I mean, I don't even know how to. he's got so much I mean, he's so old, and that I would be surprised if. Oh, Don, you don't have to deny it. You can accept it, dude. Oh,
If they're afraid, it's okay.
yeah.
I don't want to put too much pressure.
I mean,
But I do
yeah.
find it interesting, sort of the hubris of these. According to the article, it's like he's ignoring some doctor's orders about his aspirin intake. Of like, no, this is something that I've done for 20 years, and therefore I don't care what the doctors say.
Yeah, man, he's so on this, like, he's so off on his own. He doesn't believe in medical science. He thinks that the body has a battery. He thinks that there's all these weird medical takes that he has, that I'm not surprised that he's, off on his own kind of thing.
And I think he literally admits to using makeup to cover up his bruises, like on his hands.
Oh yeah,
and
it's obvious.
Almost certainly, like that bruising is almost certainly the result of all the aspirin that he takes.
Mm-hmm. Yeah, that's a good point. Well, it looks like Don can't join. I think it looks like they got like live restricted or something.
Oh, that's unfortunate. Okay, well, if that's the case, then I don't want to like.
Maybe they've been spreading some misinformation.
Exactly.
That could be a problem. All right. Yeah. I don't want to make fun of you if you just got a restriction on your account. Hopefully, we can have you at some other time come in and let us know what your perspective is, because we're always interested in hearing. But thanks for trying to join in any which way, and do come back. So yeah.
But this I'm curious how this is going to play out, because there was understandably a lot of rhetoric around Joe Biden's health and how pretty much one of the conservative talking points is like, the left is covering up all of Joe Biden's health issues, but then it seems like we have the exact same thing playing out with Trump, like where he's claiming he's like in perfect health, although I think it's clearly that he's not.
The best health ever that's ever been. That's ever been. So it's yeah, man. I can't even imagine a world where he naturally the post-Trump world that we are going to live in is going to be very interesting. I mean, who knows how it's going to be, and how many. I don't know. I don't see that MAGA goes any further than Trump. Like, nobody has the demagoguery as him. Like, nobody has been able to really wield this like cult-like figure that he is. Like, it's definitely not JD Vance. JD Vance will definitely not wield any power after Trump.
I agree. He probably doesn't have the charisma, but I would say never, or I don't want to get complacent or just assume that MAGA is going to move on when Trump is out of office or Trump is gone. I think that enthusiasm has to go somewhere. And I wouldn't put it past it. There could be something worse out there. Who knows?
I think like someone like Stephen Miller would be like the true fascist protege that is, something like him. I don't. That's who I would really be worried about. But he's not. Again, he's not like he's not good. Like, he's not good at like getting them all riled up. He doesn't have that charisma that Trump has, apparently. Like, even I mean in the Hunter Biden interview on the Sean Ryan, like there's the Sean
I watched
Ryan.
that. Yeah, that was good.
Oh, nice.
Good interview.
Dude, isn't Hunter? I really like Hunter Biden. I don't know. I don't know, dude.
He speaks well. He speaks well, and he owns his demons, so to speak, and recognizes them.
I trust him so much. I trust someone so much more that's gone down a path and that says, this is my bad, I'm self-correcting, I'm going down this other path, than someone that's just like that like someone like Trump or someone that thinks they're perfect and they're never done a bad thing in their life, and so it's like he's being reformed, and but yeah, man, I was just like,
I would even
really,
encourage him to run just as a big sort of like FU to Meg. I would hope that if he runs, like just the left rallies around him, that would be like I think almost the ultimate like slap in the face.
But dude, even he said that like that Trump like privately, like outside of the cameras and stuff, is very charismatic. Like he even told Biden that like, yeah, oh yeah, we would be friends, if it wasn't for politics and all that kind of stuff. And he was talking about, to Joe Biden, talking about that. And
Trump isn't confrontational. This is the thing that people like. Trump is like blusterous, like in front of a camera, but actually not in private. This has like been reported many, many times before.
It's
and
a
that
standard
one,
bully
just
of like once they're confronted, like they will back
yeah,
down.
but it's not even confronted. It's like he doesn't. He's just like has a different mannerism about him. Like when the cameras aren't looking, he knows like how to turn it up. Right, when a camera in front of him to like act as an alpha, but like one, he's just a lot softer than he wants people to think, right? And two, like people constantly report, right, that like when you can just talk to them, have a civil conversation. People are amazed by this. They didn't actually spit in their face, right? Like this is another person people said this about was Rush Limbaugh. Rush Limbaugh, awful individual, nasty individual, disgusting. But yeah,
nasty
off camera,
really nasty to other people.
yeah. But off camera, yeah, people had like civil conversations. They were shocked, right? But yeah, like this is the job. This is part of the grift. Like whatever. As soon as he gets in front of the camera and he has a reason to do so, a profit to be made, right? He will absolutely toss you under the bus, right? But in front, he'll oh well, maybe it was just too much, like getting to know you, you're not so bad, right? These are those types, like a piece of crap. So, yeah.
I mean, being so two-faced, I think it shows like a level of like disingenuousness or grifting or kind of duplicitousness that's like, I don't actually care about these issues at all, and this is just kind of a facade. That's the kind of the weird part about it for me.
I don't disagree, but like there are people that genuinely believe that Trump cares about them, or like their demographic, or like some people genuinely believe that he's appointed by God or like chosen by God to like take care of them.
Exactly.
And I yeah, that's a very interesting phenomenon to me of like, but maybe maybe my perception is warped. Like I see the two-facedness or the duplicitousness, but then other people don't, or some people see the complete opposite of like, no, he genuinely cares. He's a true Christian chosen by God.
Exactly. Although them putting their hand on Trump is like so wild, man.
Yeah. And it's like, I'm curious, like, yeah, what is their perspective? Like, what are they seeing that I'm not seeing? It's clearly something. I'm sure they're asking the same questions about me, but like, yeah, I don't know. This is something I always go back and forth on.
Yeah. Thank you. I appreciate that, man. Exactly, dude. It's like, but it's really interesting, man. Like the Hunter Biden's like interview, it was so
he seems very locked into the political landscape and pretty much like
exactly
knows what's going
so
on.
well educated like about what's going on, and he's not like just regurgitating like things. Like he's gone through it. He has like wisdom about like this messed up political reality that we're living in, and he's one of the only people that I've heard that actually talks about I call it like critical social media theory or something. I don't know what the word is, but he uses it as like, we are victims of our algorithm. My guiding theory right now is that basically our algorithms are shaping how people view reality. Like the algorithms actually show like people a view of reality, and unless we get a hold of those algorithms, we're never going to be able to live in the same world than everyone else. Like it's just never going to happen. But he actually talks about this, like because Sean was like saying some stuff, and he was like, Sean, you are and I am all victims of our algorithm, and because he was talking about the Biden laptop thing. the Hunter
Yep.
Biden laptop that doesn't even exist. There's no evidence that this thing actually ever does exist, that it ever was real. That it's just basically all of the information that they've stolen about, you know, Hunter Biden over however many years, and now it's something that everyone thinks that it does exist.
Yeah, and I think I'm coming to this conclusion more and more over time of like, I think arguably in my mind, like the biggest issue of our time, or is going to be just more and more problematic, is just the information landscape, especially like with AI. I was like trying to discern what is real versus not real versus truth, what is not truth, and based off of like, and now with AI and all the stuff that it's doing in terms of polluting our information landscape. I mean, there's a reason why, again, going back to the vaccines, why there's increased vaccine hesitancy or skepticism or just outright anti-vax sentiments. Like, and yeah, it's bizarre that there are still people that genuinely believe that ivermectin will cure everything, right? Or that hydroxychloroquine will cure everything. But the information is there, but they're clearly being fed something that is getting these ideas deeply embedded into their brain. And yeah, it goes back to the algorithm and the information landscape of like, yeah, I think this is like arguably like the foundational issue in my mind of like just how to navigate the information landscape, or how our information landscape is being polluted, and that we can no longer really discern reality from not reality.
Yeah, I think it's true. I think it's definitely true. People are being, and it shows like let's say we've created a universal basic income or something, like, and we did something that's genuinely perceived as good, and we do it and we improve people's material conditions, because that's how, you know, that's the carte blanche, like, default, that we just didn't, like, Biden didn't improve the material conditions of the voters, so that's why they didn't vote for him. With critical social media theory, my hypothesis is that it wouldn't matter if you actually improved their material conditions, because what would happen is that everyone's algorithm would be filled with, oh my gosh, but my material conditions got improved less than this guy. Did you hear about this guy that actually is gaming the system and he's actually doing way better, you know, than me? So it's like, even in a world where we got UBI, oh my gosh, someone's getting a double payment, or someone's getting more than that. You know, these fake stories would bubble up, and it would basically create a reality where people are like, well, guess, you know what? I don't want a UBI. I don't think that's good. You know, so it would create these false stories, and it would push people to the point where they're against their own, their own
Interests. Yeah. And to that point, and actually to bring up a sort of a conversation or a debate that me and Prime had yesterday, it's like, yeah, perception is everything. And like yesterday, me and Prime were involved in a debate of like, what should be the path forward for the Democratic Party? Should they be should they moderate, or should they be more left? And one of our debate opponents brought up of like, well, in their mind, okay, the left was losing because it's like, from their perception, basically they brought up like white guilt and DEI. It's like these issues were the reason why the left has lost in 2024, and they put these like as like top issues. At least that's what I understood from them. They included this in their opening statement of like, yeah, this aspect of white guilt and DEI, like these were the primary reasons why the left lost in 2024. And it's like, well, where is that coming from? But I have no doubt that there's something in their perception. There's something that is either being fed to them, or they're seeking out, or both, that idea is being implanted in their brain of like the white guilt and the DEI. And that's why the left lost in 2024, even though I don't think there's any real data to back that up.
It was the number one and the number two things were people voting on immigration and trans rights, and like immigration was a non-issue for the United States, and it actually helped our economy. And trans issues, Kamala Harris never even talked about them. It was like one interview from 10 years ago on one question on one thing, and it was a completely weaponized fake issue that that the Trump administration concocted that only existed in algorithms and only existed in people's feeds, and therefore it existed, and that's why it was a real thing. So again, it's just like in my view, like I actually don't even think that like issues are what we should be voting for, or in my view, what the Democratic Party is at a Y of, do we go by the 1790s Constitution or do we go by the 2025-2026 Constitution? And because if we are trying to go back to the 1790s Constitution, then we have to have Nuremberg 2.0, basically put these people on trial. And I honestly think we should do that anyway. But like, the other way is like, do we just keep going with this heavy unitary executive theory where the president is a quasi king, excuse me, Freudian slip, I guess. And is that where we want to go? Because by the way, if the Democrats decide, no, we want this unitary executive theory, by the way, guys, the president of the United States is just hammering down amendments that they don't like. Like, you could just have a Democratic president come in and say that I don't respect the Second Amendment anymore. It was never supposed to be about individual rights, which is correct. It's only this new thing was just from a activist judge ruling in Keller 2008, and I don't agree with it, and it's unconstitutional how it's being seen now. So therefore, the Second Amendment as it's written is illegal. You could also come in and say the Office of Monetary and Budget, OMB, you know what, we're going to actually allow everyone to sign up for Medicare tomorrow. Everyone is going to sign up for Medicare, and you can just do that. So it's like, so if we are going to go by the 2026 Constitution, like, there are some benefits for the Democrats to actually instantly change this stuff. You could.
I don't just, well, if anything, I would sort of advocate for that, or I lean towards advocating for that, of like, okay, if you want to go down this direction, let's see how you like it when someone else that you don't like is in power. I would, I don't know for sure that I exactly want this, but I hope there's maybe some similar figure on the left, like Trump, who is looking for any loophole to get what they want done. And I'm curious how the conservatives would respond to that. Like, if Trump did it, then whoever our person on the equivalent on the left is, they should be okay with that. Obviously, they're not going to be. But basically, pretty much like, I want them to be given a taste of their medicine, and I want to see how they react to it.
Yeah, I think that's only Gavin Newsom, unfortunately. I think that the only person that understands like the 2026 Constitution is Newsom, but I think that's the only person, to be honest with you. But
yeah, I don't disagree.
What are your thoughts, Prem?
Yeah, so referencing that discussion Corey and I had, I think that when we're talking about the Democratic Party, it is an institution that has been thoroughly corrupted by money. I think it's an institution that has the potential of being a force for change, but like has more often times in history done otherwise, right? Stayed the course. Only a few times has it actually, like by actually I mean like past policies to significantly like move the ball forward, right? In one area or another. These are actually rare moments. I think they're rare moments because so many in the Democratic Party aren't actually interested in these reforms. I like civil rights, like drag kicking and screaming into that, right? In fact, they had the whole Dixiecrats, like a whole section of the party specifically wasn't interested in these things, right? Gay marriage, we saw that Barack Obama, who was hesitant at the start to like
evolved, if I remember correctly.
Evolved in that. I mean, like I honestly, in my opinion, I think he was always on board with the whole thing. I don't think he gave.
Yeah, I think it was just an optics thing.
Yeah. But like, it's like from the perspective of a of a person of marginalized status, right? Like imagine like this being a political football for you, right? Like he told people and you can go back and look at interviews, right? He had an interview with um it was the Human Rights Campaign, one of the big groups that like do gay stuff. Sorry. But I apologize. But I remember, but I saw an interview where he's like talking about like they're asking about this question, like, do you support gay marriage? And he specifically says, yeah, it's something that I really thought about, and just as this moment, like I'm for what was it, but civil unions.
Yeah.
Yeah. And that was a position, right? And people just kind of assumed that his position was different there. That one actually worked out for us because that's where he actually was. But in other areas, right? Um, specifically in terms of like healthcare, he flirted with single payer, right? He wanted people to think that he was for a single payer or at the very least public option. He never was at all. He wanted to do a Republican plan, and he did do a Republican plan. And it's just another example of how Democrats will basically try anything and everything before they try the moral answer. Um, and again, look, I currently don't have a better option in our two-party system, a viable option, I should say. But like, I think that it requires, like, if we're going to work within an electoral space, and that shouldn't be the only place we work, we should do more than just be focused on the next election. But when you are working in electoral space, I think at some point you have to say, well, you aren't providing enough for me, and that like this, I know this, you have to have a bare minimum standard as to what will be provided, and it's going to be different for each and every person. But I think the Democratic Party has gone so long coasting on past victories that once again they were forced into every step of the way. And then they keep and I can speak, well, I'll speak from my perspective in the Black community, that they come to us every 4 years, hat in hand, talking about how they'll defend us from like the incoming horde of the Trump administration, right? Or the Republicans. But in the end, all they're looking to is maintain the status quo, be on defense rather than moving things forward for the community. And then they'll literally forget about us the moment the election is over. It's happened endlessly. And it's because they feel like they have us by the balls. Well, you can't vote for the Republican, right? The other option is just to not vote for you either, and that's the thing you can exercise. So,
I mean, I do think that the Democratic Party largely, I mean, Nancy Pelosi did pass the public option, in 2009, so it was only killed by Lieberman in the Senate because that was like the 60th vote that was needed. And and because they were playing by the Senate, the filibuster rules, they could have changed the filibuster rules.
There's always an excuse. There's always an excuse, right? There's always a convenient bad guy that the Democratic Party will come up with, right? Like, yeah, a lot of senators voted on it because they knew it wasn't going to work, right? Like Lieberman had no problem being a bad guy. Lieberman was like a piece of crap, like not a piece of crap. Screw that guy. But he was their boogeyman then. Joe Manchin became their boogeyman later on, right? And this is like, and what I'm telling you is the actual thing they do, right? On votes that they don't want to take, right? Like I know that my position as a senator is unpopular. I know that, right? And I know my constituents want something different, but I can't be seen not voting for that. So here's what we do. We'll find someone who's in a safer district, right? With more conservative values, right? Who's more upfront about that, and they'll be the bad guy, right? So we count the votes beforehand. We make sure this isn't going to pass, right? And then we all vote for it. It's like, oh no, we really wanted this, but then the bad guy did the bad guy things, and there's nothing we can do. Maybe next time. Damn it, And then during the campaign, the next campaign, they can say, I voted for this thing. I'm a champion of this thing. They do it all the time. It's a lie.
So you don't think that the House in good faith wanted to have a public option in the healthcare thing?
I don't know what the exact House vote is, but in terms of the Senate, which is where legislation goes to die, right? For the Senate, I would say there were less senators, significantly less senators than that wanted it than voted for it, right? So like there was a certain number who voted for it. That would be 59, I guess, in this case, right? But like what the actual number is, I'd just be speculating, right? But like I'm surprised they got 50 votes, like honest, genuine votes. I'd be shocked if they had 50 genuine votes at that point in time. They were all taking money from the health industry. They're all taking their money, right? And the health industry is one of the major, this is well known, one of the major donors on Capitol Hill. So, but again, they know they're scummy. They know they're slimy bastards. They all know, right? And yet they took the effort to and yet they want to be seen as being responsible individuals, right? And so for these crucial votes, they're show votes. It happens all the time. I am not making this up. Look this up yourself. They do this all the time.
I guess that's like from as I see it, that is the old style of governance, and that's the old style that is the 1790s Constitution. And I think that the Democrats could play that game again, like if they want to. But as you're pointing out, like it's very slow going. It's very, not good for our content creator president, which is the whole role of his. He's that's what he is. That's what they
You're
are.
right. You're right.
No, they didn't like Biden passing legislation and actually doing things presidential. But what you need to be as a president is you need to be out there. You need to be creating content every day. You need to be showing people what you're doing. You need to have press conferences every day.
Signing executive orders, and that's about it.
Yep, exactly. Just out there, just doing things like live streaming the presidency, basically. I mean, this is what people like. This is what people want. So that's the problem. And it's like, are we going to create a Ruben? But it's exhausting, but that's what people wanted. The whole reason why they have the sleepy Joe Biden thing and he's hiding in a bunker is because he was actually doing presidential things. That's the problem, man. So I feel
meanwhile,
like
Trump is caught on camera sleeping, but he denies it now. They caught him blinking.
Oh, it's because he's hardworking and because he's out there all the time. That's why he goes to sleep, as opposed to Biden that's not doing press conferences. He's caught like dozing for a second, and now it's it's because he's old and So I think that, like, again, I think that you just say this is what the Constitution is now. This is the president that we have now has quasi king powers. It's there. The power is there if they wield it. ATI 23 in Prime Chat, like what I was talking about, the Second Amendment is from Sotomayor's own words in her dissent on, I think it was, I forget what it was, what state it was, but it was basically a district court judge saying that the president can be restrained by a judge's opinion, and the Supreme Court said that no, the executive cannot be restrained by a judicial opinion and hampered on going through. And this is for the birthright citizen case. So again, in her dissent, she literally talks about like you are creating a world and a judicial precedent now where you're going to have a president come in and say, just like you are, basically not agreeing and not agreeing to the birthright citizen amendment, you're going to have the same thing with the Second Amendment. You could have the same thing with and just say it's a First Amendment right to have health care. because you in order to be healthy, in order to be like giving speech, you have to be healthy in order to give that speech. So therefore, it's a First Amendment right in order to have healthcare in this country. And now everyone has healthcare, and you just sign everyone up. Like that could happen. That could happen, guys. That could absolutely happen if we have a president that's actually pushing for it. And I don't think that, again, I don't think that any other president understands this other candidate other than Newsom. That's what it is. It doesn't matter what his opinions are. It has nothing. I used to be I'm going to read the 100-page memo on what Kamala Harris's, healthcare decision is, or her right. And I was reading that stuff. Now we're going on vibes, man. 100%. If that's what people are going on, I'm going on vibe presidencies. And I'm telling you, the only person that understands the current political system is Newsom. That's just me, though.
It's the social media game. That's for sure.
Yeah, and understands how the game's being played right now. And that's the thing. Like it's nothing about the legislative process that Prime was outlining, right? And that's the political morass that people hate. It molasses and it gunks things up, and nobody wants to watch our government not be able to respond to what's happening. If that's what people want, I mean, I don't know. What do we say? What do we do?
Well, I wish I had an answer, but I guess it all goes back to, like, you said you're not going to read, that 100-page memo, which is understandable. But then let's say for the other voters, going back to reading comprehension, right? What do you do with the general population of, like, do they even have the tools to read a memo like that, or to go in there and understand the policies and all that stuff? It's like, if they're not equipped with the tools, then they have to go by vibes, right?
I mean, legislatively, the president doesn't write legislation, right? I mean, that is the reality of our system. You pass whatever legislation is written by the legislative body that you vote in. So the president shouldn't be this, like, this is the things that we're going to do in order to do it. I mean, under the old Constitution, but under the new Constitution, you can. I mean, it's just it's frustrating. Like, I love our 1790s Constitution because of the democracy aspect, because it is something that's unique. That has the judicial system, that everyone has, there's sort of a trial, there's a process that's due to every single person, citizen or not, in the United States. That is what the due process is, that you should know what your crime is. You should, I think there's a lot of problems, obviously, with how it was written originally, but I do think that they are, it's tending towards a more perfect union. But that Constitution's dead. It just is. And you can't have, like, one party going by this 2026 Constitution and one party going by the 1790s. It's just, you can't have two different rules for two different teams.
I don't disagree at all.
Prime, who do you think would be the 2026 champion that the Democrats need? Like, for the new Constitution, the new USA.
Well, so are you asking
what do you think? Do you think about
that they need, or what does Prime want? Or is that
I was going, yeah, Corey, you read my mind.
I know.
That's exactly what I was gonna say.
Okay.
What do they need and what do they want? What they want is another milquetoast centrist, corporate liberal. That's what they want, and that's why they have been framing the last election, the presidential election, as a loss, like, done by progressives, right? Like it was their fault. Also, it's because, like, one, they didn't bother to vote for us, so we can't make them happy, even though we never did actually tried. And two, we were too woke. Kamala Harris was too woke at the time, right? And that's what lost the election, right? Everything is wrong except, like, the actions of Kamala Harris, the actions of Joe Biden. Those are the things they actually absolutely don't want to reckon with, right? They want to do the exact same. They want to run the exact same playbook. Like 24 was such a deep loss that, like, exposed the rot to everyone else, but, like, other than the people who live in Washington D.C. and to people within like mainstream media, right? The NBC News and your New York Times, the Washington Post, right? Like, except for those people in the editorial pages, everyone else saw a complete failure of the Democratic Party there, like a complete and utter failure, like landslide loss. It's just so many things went wrong that everyone else can see it. Biden's dementia, they lied to us about, all those things. But none of it they want the Democratic Party wants to examine. Not a single bit of it. Even, and I mean that literally, right? There was going to be a Democratic Party autopsy. Do you remember this? Like the Republicans had an autopsy like years ago when I guess maybe it was when Biden lost. No, sorry, not Biden. Sorry, when Trump lost. They like put out these autopsies right after like a loss. Like, okay, well, this is where we went wrong, and this is how we should do better. The Democrats just buried the autopsy. They don't want to talk about it. They don't want to talk about it. They don't want to do it. They don't want to talk about it, right? So what they want, milquetoast corporate Democrat, right? What they need, I would think, is that Zoran Mamdani energy. That's what I would say. Now, in terms of like what's the candidate? Zoran is not going to be the candidate. I mean, he's in office, he's the mayor, but I'm saying like that type of energy, those types of candidates, right? Getting behind them and not fighting them every step of the way. Candidates that aren't afraid to tell Israel to go to hell. Clearly, the party has moved away from Israel. Clearly, the base has. Overwhelmingly so, but and increasingly so as the days go by, but they don't want to tackle this issue, and so I mean that would be one. That's my particular like major issue, of course, but also like people putting out bold legislation, bold initiatives, right? That's what Zoran did. He put out a bold, forward-facing initiative, not just saying Trump is bad, vote for me, I'm not Trump, right? That's most of their freaking campaign. That's most of Kamala Harris' campaign. You remember how bad Trump was? We don't want to do that again. Guess what? They didn't mind. They didn't mind so much, right? And you lost miserably. Lost the popular vote because that's just not enough. People need, if you inspire them, especially the Democratic Party. The Democratic Party needs to be inspired, right? That's the base that we have here. People need to be inspired, and you get people out. Like you have to show, and you actually have to mean it, right? If you show a level of sincerity, that gets people out. Now, it doesn't have to be like quote unquote impossible legislation. This is what Corey and I we had a debate last night, and like, without even naming the progressive policy, all of it was simply named as like populist wish fulfillment, which can never happen, right? Just like totally like in the clouds thinking, right? Again, without actually naming any policy in particular, but just all of it was just bad, right? But progressives have actionable policies that are popular within the citizenry, right? The voting base, they care about these things. But these just never seem to make it up to the federal level. Certainly, right? Sometimes they make it up to the state level, but not in the federal level. So just very quickly for Dr. Greg, what I was saying is that like what they need is forward facing policy that inspires, right? That's what Zoran's doing. And Zoran, except for maybe the rental freeze, except for that thing, right? Like nothing he's saying is like particularly radical. Like these are actually like they're left leaning policies, but like they're not like smashing Wall Street, right? They're very basic reforms and changes and improvements, right, that are left leaning, but like just that much we're so starved for that in this country, that this is like the most exciting candidacy we've seen in such a long time, because we get none of that from the Democratic Party. So what they need is Zoran energy, right? What they want is more sleepy Joe Biden energy.
They want Chuck Schumer energy.
I gotta
You want Chuck
stand up,
Schumer, aren't you?
I gotta stand up for my favorite president of my lifetime. Okay, Biden. What I genuinely don't understand, man, is that I don't understand like the legislative success of Biden versus like how people are seen against him. And he did have a ton of legislative success, man. Like he did the Chips and Science Act, the Infrastructure Bill, the Inflation Reduction Act. I mean,
Funded a genocide. Yeah.
well, I mean, for Israel Palestine, are we talking about?
Yeah, funded a genocide. Yeah.
I mean, okay. I mean,
Yeah.
but we're talking
Put the
about
genocide aside. Yeah. We're talking about a bigger issue. But he did fund a genocide. Like,
but obviously, like the United States wasn't the key player in that because obviously
yes, we
only
were.
gotten
Yeah,
worse.
absolutely a key player in that. We funded the genocide. The genocide could not have happened without our constant, without our approval. Israel being a vassal state of ours, and without the money that we provided them, we funded a genocide. We funded it. And even if you say that like it could have happened without us, well, it's literally illegal. Literally within American law, it's illegal to be funding conflicts, like providing weaponry into conflicts where war crimes will be committed, right? That the actors you're giving it to are committing war crimes, right? That's the Leahy law. You can look it up. It's in American law. We've ignored that. Biden administration made sure to ignore that. Even his own State Department made those adjudications, right? Those reports are buried within the State Department. So yes, one way or the other, whether it was it actually enabled Israel or not, still we funded the genocide. That's what he did, right?
I mean, I think like the United States had already been a partner with Israel and in that scenario and
We've been
before
funding ethnic cleansing for a long time. Yeah, not just under Joe Biden, but other places. But yeah, we've been part and parcel of the humanitarian crimes that have been in Palestine for a long time. Yeah, we've helped with the settlements, right? Like the settlements, we've just allowed that to just keep going. Even though that is illegal under international law, we protected Israel every step of the way. Not just Joe Biden, right? Just many presidents, right? Democratic and Republican. But Joe Biden just happened to be office when the genocide kicked off, and he funded that enthusiastically.
I mean, I wouldn't say enthusiastically. I mean,
no, absolutely enthusiastically. Biden is a huge Zionist. He's a massive Zionist. Like there was an incident. This is years ago. Decades ago, where like Zion, it was, I believe he was talking to like a prime minister of Israel, and he was talking about his plans, his thoughts for Israel, and like that prime minister was like, wait a minute, this guy's a little crazy. Like he was such a Zionist, he was out Zionisting the prime minister of Israel at the time. Like this guy is absolutely wanted to do this. He pretended otherwise. He started because it became quickly unpopular, right? People saw the horrors, despite the mainstream media's best efforts to cover it up. But they saw the horrors, and then he started making noises. Oh yes, we also have to consider the people in Palestine, right? But then all his actions said otherwise, all of them. So yeah, he funded a genocide. Let's never forget that.
I mean, I guess he also helped the 500,000 people that died in South Sudan and the genocide that happened there. So he was on the other side of there, and it would have been way worse if it wasn't for USAID and doing the humanitarian effort there. So I guess, I don't know. It is what it is, kind of thing.
Is it what it is? Is it what it is? No, it's not what it is, right? Like, yes, there was a different political calculation made on the other end, but Sudan, the actors in Sudan, like the belligerent actors, yeah, they don't have a foothold within the United States government, right? Israel has a deep foothold here. Israel has a huge fundraising and political campaign of a machine that they keep exercising to this day. So yeah, like it's much easier in Sudan when like they're just not really too much to lose one or the other. The UAE is involved, and Saudi Arabia is involved in that, right? But other than that, really, like there's in terms for from the U.S. perspective, whatever you can just you can use this as a PR moment, but like Israel is where U.S. is invested in. Israel is our imperialist front within the Middle East. Yeah, Israel is where it matters for American values. That's the constant test of American values because Israel has been doing these humanitarian these crimes against humanity, right? For legit since the creation of the very state. So yeah, he funded a genocide. Sorry, there's no avoiding it. There's no avoiding that.
Again, I think it's like they tried to stop the slaughter of 500,000 people and
yeah, and they insisted the slaughter of thousands and the starving of tens of thousands.
It's not good. I don't agree with that, and it's not. I would but guess what? The pressure that diplomatically was on Israel before with Biden was way worse than they had the ceasefire. They went through with the ceasefire. You could say that the red lines weren't there and that kind of thing. I think that's fine, but yeah,
ceasefire that immediately dissolved like 2 seconds later. The ceasefire that happened
at least
while Biden was on it, that happened while Biden's on his way out, where it seemed clear that the reason why they did it is because Trump was on their way in, the preferred candidate. Israel's preferred candidate, even though Biden gave them everything they wanted, Trump was still the preferred candidate, and so they gave him a political win by doing a ceasefire, but that immediately dissolved any which way. That ceasefire, right? The one that just never materialized previously. But again, once Trump was coming into office, the Israel gave him the optical win. That one, okay. I mean, I don't know, man. Like everyone within the political establishment at the time, 2023, when the attack happened, the October 7th attack happened, thought like, oh yeah, Israel's going to get its get back. They're going to bomb. It's going to be bad, right? They're going to knock down some buildings. They're going to kill quite a few people. But, then they'll go to their separate corners. And certainly America will step in. Everyone's prepared for that. Even our U.S. Secretary of State, right? The world thought that was the case. But then just kept going on and on and on. And Biden said, yeah, well, we have to back our ally. We have to back our ally, right? And this was a test of the Democratic Party. Well, okay, we see this humanitarian crisis unfold. The world is horrified about what's happening, right? So Democratic Party, that's this entire time is pretending to be the peace party. So Democratic Party, who pretends to be like the bulwark for civil rights and everything the Republican Party isn't, right? With their warmongering. What will you do? What they'll do is they'll enthusiastically support a genocide. That's what happened.
I mean, what's your solution then? Never support the Democratic
Don't support
Party.
A genocide. That's my solution. Absolutely, that would be my solution.
I know, but
don't support a genocide. You don't support a genocidal regime. Do that.
Okay, so you're just never going to support the Democratic Party ever again?
If they continue supporting a genocidal regime, yeah, I won't be supporting that. That is my minimum right there. Hey, don't support genocide. Don't support it. We're done with that. We should be done with that. The party, the base, by that I mean the Democratic base, has clearly stated that that they can't support Israel anymore, right? Like we're seeing that across the board, that support for Israel is dropping, even on the Republican end, but less so, admittedly, of course. So yeah, if the party cannot respond to that, to this clear demand, because they're filled with Israel money in their pockets, right, through AIPAC and through their other fundraising mechanisms, well, then that's not a party that I can support. No, genocide. Yeah, that's my line. Don't support genocide. Pretty simple line.
How are you making sure that there is no like support there? I mean, are we talking about like AIPAC money? Are you talking about like laws? What are you thinking?
I'm talking about material support for the nation of Israel to if not completely cut it off, which would be I don't even dream of that. But like to show a rollback of support, right? Material rollback of support for the government. That's what it's very simple. And what people want. People don't want any more money to go. Even Republicans, right, are talking about this right now. They're doing it from a different aspect. They don't care about like the humanitarian crisis so much, right? But they care about America first, right? We want money for America to stay here, right, and not be supporting these other foreign conflicts. And they also, because as we're seeing current now, we don't want to be dragged into another world war by Israel. So they don't want to start bombing Iran. They have absolutely no interest in that, right? That is clearly uh, a foreign policy objective of Israel being imposed on us, right? And they're saying, hey, either you're America first or you're Israel first. And there's a divide happening within the Republican Party, a robust conversation happening even there, right? Again, they don't care about the humanitarian aspect so much. But on the Democratic Party, that's where people supposedly care, right? And this is the dividing line. And so, no, if you can't not support a genocide, then I certainly have no obligation to vote for that sort of party. Never.
And just be aware, I brought this up yesterday, I believe. Prime supported Biden in 2020, but in 2024, no longer supported him.
Yeah.
Okay. I mean, I think that the material conditions and what he did in the United States and the economic development in the United States was like $1 trillion worth of stuff that was going to go to the United States and help us for the first time. I mean, climate change is like my number one issue, which to my belief still impacts Palestine. So I think that climate change is still a really important global issue that
bombs impact more at this particular moment in time would be the bombs and the lack of food
they
and
can't,
lack of medical attention.
farm. They can't farm. There's no productivity.
Because Israel bulldozed their farms, literally and is continuing to bulldoze their farmland right now.
Sure, but even if they were given a state, they would still have the economic strife because they don't have they're still impacted by climate change. So I don't know.
Yeah, I don't think they're worried about that. I mean, like, yeah, sure, fair, but like, look, it's fair if climate change is your number one priority. I'm not saying my priority has to be your priority. I'm not saying that at all, right? But I'm just saying that like it's a BS thing to say like, oh well, climate change still is a problem for Palestine. No, the problem for Palestine right now is the fact that they're losing their land, and an ethnic cleansing campaign is happening right this second.
Agreed.
That's the immediate problem, and the U.S. is funding that.
You can do both. You can do both. You can care about both.
Oh yeah, you can care about. I care about climate change as well, right? Mm-hmm. But I won't support a party that's supporting a genocide or ethnic cleansing campaign.
Okay,
I'm not going to do it. That's a very minimum line, right? Hey, don't support genocide. Just don't do that. Or if you don't like the word genocide, because some people get very sensitive about the word genocide. It's the accurate description of what's happening. But if you're sensitive about that, right? Systematized mass murder. Don't support that, right? That's the type of party I want. A party that doesn't like that thing.
Okay. I mean, I think you're right. I agree with you. I don't think that the Democratic Party, that is their number one issue of like supporting Israel in this campaign, and that is not like what they're gung ho about. I think that the Democratic Party, the mass majority of everything that they've been doing but Biden passed was for economic development in the United States. It wasn't about that. But that is a byproduct of their Middle East involvement in Israel, and I don't think that Biden is sitting there like saying this is my number one foreign policy objective and this is what I want to happen versus
who cares where it ranks in the list. He funded a genocide. Let's say it was the bottom of the list. Who cares? He funded the genocide. What difference does it make? Oh, he had other things in mind as well. Yes, he cared a lot about Ukraine, right? Mm-hmm. Then he also funded a genocide. Like I care not one bit, right? Watching my language here on TikTok. Not one bit about like where he happened to rank it. He ranked it pretty high because he's an absolute Zionist. He's been like a pro-Zionist his entire life. His entire career, he's made it clear that Israel is a priority to him the entire time. So I don't know why we would assume that to be different now.
Because he didn't do it as president. He wasn't sitting there making speeches after speech about it.
But yes, he did. He actually had to address it. He actually had to address it all the time because it kept being brought up to him all the time, right? And what difference does it make if you make speeches about it, right? What difference does it make if you silently fund a genocide? What difference does that make? You funded a genocide. What difference does it make?
Because it's a secondary or tertiary action versus a primary campaign of
BS excuses. I'm sorry, this is just a BS excuse, right? This is a BS excuse making, right? Anything rather than blaming the person in charge, the president of the United States, who cheerleaded a genocide. He absolutely did that, and he gave the money, right? It doesn't matter if he did it quietly or he did it loudly. He did it. That's the problem.
Okay. I mean, I think the reality is, man, is that we have
the reality is the genocide took place. Yeah, that's the reality. That's the reality. We can't. Let's not try to obscure that with anything else, right? That's the reality. Now, again, my priorities don't have to be any other people's priorities, right? But a lot of people cared about my priorities. It was a big thing, right? It may not have always been like the number one thing people voted on, but it doesn't have to be the number one thing people voted on. This was a test for the Democratic Party and what you want to support. And people watching that, people like interviews after interviews, people like brought this up, right? Like randomly, not just within the like Democratic base, just everywhere. Like just like watching this genocide, like this was just it, like a reckoning with what America was, right? Because they had an idea in their mind as to what they felt this country was, what it could be, right? The values it maintained, but then it became it was a stark contrast. It was a dissonance what they were seeing on their screens, right, on their mobile phones, watching a slaughter. So yeah, the reality is there was a genocide, and the Democratic Party enthusiastically supported it because they were taking AIPAC money.
I don't think enthusiastically. I don't think it was
enthusiastically.
I don't think it was
enthusiastic. Don't again. I'm sorry. I'm not going to be allowing excuse making for the Democrat. I'm just not going to do it. I'm not going to do it. Right? I was there. I watched it happen. I was there. How Kamala Harris was shutting down protesters who came and honestly tried to address their issues with her, right? She tried to girl boss them and saying, "Excuse me, I'm talking here," right? Shutting them down when they were probably protesting, the slaughter that her administration was a part of. There was a hope at the very start of her when she jumped into the race that she might be different. That she was trying to make some space between her and them. Her and Biden. She made sure to dispel those claims. Right here was a tiny ask by the anti-Zionist movement. Right. Hey, could we have at the DNC at the convention? Right. Could we have the speaker, right, a Palestinian origin, go up and talk? Right now, the speaker would have their speech approved by the Kamala Harris campaign. Right, like this was the person they put forward was an individual part of the Democratic Party. She was I believe she was an elected official, like a local elected official somewhere, if my memory serves correctly. But she was part of the Democratic Party. She was going to give a speech the Kamala Harris campaign would approve of. Right, she was going to do that. And the Harris campaign is like, oh yeah, maybe this sounds like a good idea. All the way up until the night of the convention, and they're like, "Oh, I guess we don't have any time." They had people coming up to talking about Israelis talking about the genocide, like the October 7th attacks. And fair enough, they should be there to talk about that. It was a horrible moment in time. They allowed them to come up, but they denied this speaker a spit in the face. Right outside the DNC, there were people who were reading off out loud, reading off the names of the children who were killed and the genocide, reading them off, right? People leaving the DNC, right? The Democratic National Convention were walking out with their fingers in their ears, right? And laughing at them, telling them to shut up. That's the DNC. I'm not going to allow this to be erased. I'm not going to allow this to change history. I will never forget this moment in time. I will never forget it. And I'll keep telling this history over and over again. So when I see the excuses, I'm going to knock them down every time. Every time. Stop protecting the powerful. Stop protecting Joe Biden. Genocide Joe did this.
Yeah, I mean, I just never heard a presidential candidate in the United States talk about Palestine like Kamala Harris did, like in talking about the plight of
What did she do?
Palestinians and
She just said,
in the
what did she
speeches
do?
that she talked about.
What did
Like,
she do?
if she,
What did she say?
as a vice president, what is she supposed to do?
What did she say? What did she say? What was so amazing? What did she
I
say?
saw a couple of speeches talking about like the plight of Palestinians and
yeah, they all talked about Biden did the same thing. He talked about the plight of the Palestinians.
Yeah,
But
I mean,
she
what's wrong with that?
assured us that her position on Palestine would be no different than Joe Biden's. Yes, you can. Yes, she talked a lot. And again, this goes back to what I was saying before, right? In terms of like the Black community. Yes, every 4 years they show up and they make promises. They say we're going to provide this and that, right? They talk a big game, and then afterwards they do not a damn thing. They go back to business as usual. And she promised this. She said, "This is what I'm going to do. I will be a friend in Israel. Israel's defense must be assured," right? Which is the code word for saying we're going to give them everything they want.
I mean, at least she was talking about it. At least she was saying
No, stop it. Stop at least that she was talking about it. Stop with this. Again, you're doing the excuse making. At least she said some nice words and then the bombs still fall. Stop it. Action is all that matters, right? Or at least in this case, because she was trying to get into office, right? Simply a promise of actual action. Say, hey, here's how I'm going to break. I hear you, right? I hear that there's a need within a Democratic base, a clamor, right? And I'm going to respond to it. Here's the policy I'm going to put forward. She did not do that. She did not do that.
I mean, I think the material conditions of Palestine right now compared to with Trump would be drastically different with Kamala as president.
I mean, this is, I mean, like, whatever. I mean, like, yeah, sure, whatever. Genocide slightly less. Well, genocide slightly softer. Like, come on, this is the best. This is the best the liberals have. This is the best. They'll genocide softer. That's literally the best they have. No, for me, and again, I'm not speaking for anyone else. I don't speak for, well, Corey's Canadian, so it doesn't matter. I'm not speaking for anyone else, and other people can have their own opinion on this. No, my minimum, right? Like, if there was a party, if the Democratic Party was saying, "Hey, we're going to essay," I'm on TikTok here. We're going to SA children, right? Slightly less than the Republicans are going to SA children, right? Yeah, I wouldn't vote for them either. Right, slightly less government-funded SA of children is still pretty goddamn horrible. That I wouldn't accept that of that party. You haven't met my minimum standard. So no, a slightly softer genocide does not appeal to me.
Okay, I mean, it's frustrating the lack of action that the United States had. I agree that it is like, you know, it sucks. It's a bad position that the Palestinians are in. I think that they should have their own state. I think that, you know, Jerusalem should be a third party. I like the original UN declaration where it was a third party, you know, controlling the temple on the mount where all three religions have, you know, some claim. I think that that's what they should be shooting for. Okay, but in reality is that the Democratic Party is going a lot more closer to that goal than the Republican one.
No, they're not. No, they're not. Let's knock that off. Knock that off.
You don't think that
that's BS? Hold on.
The Republicans are the ones.
I wasn't gonna say anything. I was just gonna leave it alone. But no, like the Democratic Party is also running interference for Israel, right? When they're talking about this idea of a two-state solution, the two-state solution, like Israel says it too, oh, we're looking for a two-state solution, right? And as they are bulldozing, they're not going to actually, if there is no effort, no pressure put on Israel to from the outside to do that, they simply won't do it. They can just keep saying, oh, the conditions aren't right for a two-state solution the entire time, as they keep stealing the land, as they keep bulldozing Israeli home in the West Bank, right? As they keep doing the thing they've been doing for decades, right? And the entire time they can say, oh, we're moving forward for a two-state solution, but then they can find out another reason of why it can't happen. The Abraham Accords was the inciting incident was part of the incident for the October 7th attacks, because what Israel was doing with the United States' help was getting the neighboring Arabic countries on their side, right, economically, sign these accords, and let's not talk about like the Palestinian question. That thing got sidestepped, right? And Hamas is like, we understand what's happening, like the while the people of those Arabic nations are very much pro-Palestine, right? The authoritarian rulers on at the top, they don't care. They're just looking to make money. They don't care about that at all, right? And they saw that policy moving, and they had to make a crisis that would force the question. That's what happened. Now, I'm not, to be very clear, I'm not like excusing the attacks. I'm not doing that at all, right? Not at all, not at all. I'm just like, this is the thinking that was happening at the time, right? But the U.S. was a part of this, right? Hey, let's just try to sidestep the Palestinian problem, right? And just like make all these economic ties, and then like get them closer to Israel's side, right? And then you can just kind of do what you want without those governments interfering. That was the goal. So when they talk about two-state solution, that's just a placeholder, right? For all of us, right? To assume, well, at some point in the future, something is going to happen. It never has, and without the U.S. actually taking an active role, a positive role, it never will.
Okay. Yeah, I don't know, man. I think it's a really there's a lot going on in that region, and it sucks. I don't know. It just does. I don't think that Israel has like a stranglehold over our politics. I definitely
absolutely don't.
I don't think that's true.
Even at this now, they literally are Israel cutouts, right, and allies are literally buying up our media. They bought TikTok, like the Oracle run by the Ellisons, right? They are deeply pro-Zionist. Literally, there's an article talking about the relationships between the Ellisons and in Israel, and they talked about how like the younger Ellison, I forget what his name is, but the son, right? How literally he grew up like around Netanyahu, and Netanyahu, as they described in the article, was an uncle figure to him. Those are the people who just bought the U.S. TikTok. They bought CBS as well, right? They shut down in CBS. We saw this just the other week, right? They shut down that news article. Yeah, the CCOT news article, right, for the administration. These individuals are taking an active role. They put in place within TikTok, within Facebook, I believe also within Twitter, but I can't remember now, right? Individuals who are content moderators, right? Some of them literally used to work for the IDF. They are taking over our media right this second, buying it. You're seeing in articles right now. That's what's happening. Look it up. It's right there. They're not lying by it. They have conferences where they brag about how much they're censoring the content for Israel's benefit. So yeah, like let's stop like with the excuses. Let's stop with excuses. We know what's happening. Everyone knows what's happening.
Corey, you have any ideas or just,
No, I don't have any ideas.
I think what you're talking about is the permeations of like a billionaire, and again, how much control and how much power and influence that they have in this. I don't think that it's like Israel directed. I don't think that it's
they're Zionistic. They donate a ton of money to Israel. They like Netanyahu. Sorry, the Israeli government uses again, I think Larry Ellison is the older one. If I'm wrong, I forget, but I'm pretty sure Larry Ellison's the older one, right? They use him as a cutout, as a what was I going to say? He basically. So I'm just going to explain what happened, right? Marco Rubio was a candidate they were interested in, right? Hey, we like Marco Rubio, but we need to make sure he's on Israel's side. Who they send to talk to him? They sent Larry Ellison. Larry Ellison talked to Marco Rubio and reported back, oh yeah, he'll do whatever you want. And so the Israeli lobby supported him. Like that's how deep in it he is. He's like absolutely involved, right? Just like the Adelsons. Sheldon Adelson and his wife, whatever her name is, Miriam Adelson, deeply involved, like huge donors, right? I think they have Israeli citizenship. I don't know if Ellison has that. Deeply involved with it. So yes, what are you pretending? This is all obvious.
Again, dude, a lot of billionaires have a lot of like connections. I don't know. I just don't think that it's.
Why are you desperate for excuses? I
No,
don't understand what's
I don't-
happening.
I'm not-
What are you trying to do?
I'm not
Why are
trying
you
to do
desperate?
anything.
What are you trying to excuse here? What are you trying to protect here?
I'm not trying to protect anything. I'm just saying
Okay.
that there's a lot of people that are trying to tie everything to Israel right now, and I just don't.
Yeah, I know. You haven't looked into it at all. You haven't looked into this at all. But like these aren't hidden connections. These are their main connections, their main advocacy. His advocacy has been for Israel. Ellison has been deeply tied in with the intelligence agency from the start. That's how Oracle got to start making databases for the CIA. This is all in public. You can just look it up, right? This is not a secret, right? He got money for like making databases for the CIA. But then, like as his business has grown, he's been bear hugging the Israeli. Again, Netanyahu, close personal friend. What is there to what are you pretending isn't here?
What's your solution, man? Going forward? What do we?
I've been very clear about my solution. I've been very clear my solution. Right? We stop material support for Israel.
Okay. Okay. I mean, I'm fine with that.
Or we condition it anyway, right? Like we could like restart it if they they stop being stop with the war crimes. But you could at the very least condition the aid, right, on no war crimes. Knock it off, buddy. Yeah, that kind of thing.
Okay, guys, I understand Venezuela. Something's going on in Venezuela. I don't think we should cover a breaking news story that has the implications of that. I don't know. I would rather just wait for news to actually cover it, and then we can talk about that later.
Yeah, it's a bit dicey to cover breaking news without details.
I think, dude, I love what you're talking about. I totally agree that there should be. I would love for accountability and transparency in our government and where the money is going and all that's happening. I would love that to be the world that we live in. I don't know if I don't think that we're ever going to get that. And my worry is that like the opaqueness of and the power of billionaires and stuff can just basically create these webs of ties that it's like, how do we know? You know what I mean? It's just, I don't
know. Sorry, go ahead.
I'm not saying what you're saying isn't in the open and it hasn't been verified, and that's okay. Like let's say that it is, but like I don't know other than what to do. Like play the cards in the hand that have been played with us. Like materially, it's way tighter. Netanyahu and Trump is way tighter than anything that the Democrats were ever.
Democrats have always been tight of Israel. I don't know what you're talking about. Like they were like, what is this separation
with Trump? With Trump and Netanyahu,
they're taking the money. They all been taking the money. They all been taking the money though, right? Like yes, they. No, you're right. The Israelis like Trump better. That's true, and I said that previously. They like Trump better, but effectively they get almost everything they want from the Democrats, right? Like, yeah, like one is 100%, one is 98%, but like again, if you're fine with accepting crumbs from the Democratic Party, like I was talking about before, if you're fine with the crumbs, well then please continue to vote for them, right? If you have no minimum threshold, if genocide isn't a minimum threshold, then yeah, just vote for them. But I have standards. And my standards aren't very high. Don't support a genocide, right? When in school, when they taught me never again, I actually meant that. Some people didn't. The Democratic Party didn't. They didn't mean that, right? They meant like never again will Jews have to face that kind of murder. And I don't want my Jewish friends to face that kind of oppression, right? But for everyone else, if they're in the Israelis' way, right? Oh well, I meant it.
I just don't see how like material conditions for everyone in the globe gets worse with Trump and the Republicans. Everyone in Israel and Palestine
My
gets
vote was
worse.
not
And
contingent
in
on that.
my life, on like my career as a scientist, my kids going to school with unvaccinated people is
You can vote for however you want. I'm not telling that you vote for. You have
I'm saying
my.
materially the conditions worldwide, the quality of life is much worse.
Yeah, you can vote however you like. I'm saying this is why I didn't vote for Joe Biden, and I won't vote for any Democratic candidate who says they support Israel. Not going to do it. Not going to. And a lot of the people aren't going to do it too, right?
I mean,
We were
you're
underestimated previously. We were underestimated previously as to what kind of impact this was had, right? It had a big impact on the election. People kind of pretend like it doesn't. It didn't. They're desperate. Again, this is you're just like doing the thing that I was just describing, right? Like the Democratic autopsy. These are the things they don't actually want to look at, right? When it talks about actually blaming the party, or sorry, evaluating the party, evaluating what the leaders did, right? Evaluating the lies, right? Like the lie that that Joe Biden was helping, didn't his mind wasn't deteriorating, right? Like that was a deep lie to the American people. People remember that, how like they were gaslit by the Democratic Party, by like the very top of the administration, right, and by the mass media to say that yeah, this guy was fine, until it was so obvious that it couldn't be denied, right? Until he like failed miserably at that debate stage, right? They lied and lied and lied and lied some more until they couldn't lie anymore. That's the thing that happened, and that's the thing that they don't want to actually reckon with, right? And this is another one of those things. Don't want to reckon with it. So you can bury your head in a sand and say, well, you know, what's to be done, or you can demand more from the party. You can actually try to demand more from the party. If you don't, I mean, I don't know what to tell you, man. Like this
Okay,
is
so then the people that withheld their vote, and and in Minnesota, you're right. There were cities that had a 40-point swing for for Trump. I mean, are there like their outcomes and what they're saying?
that's not how voting works. People like don't vote that way, right? You're saying that, oh well, you know, things ended up worse for you, whatever, right? People need to be motivated to get to the polls. That's just the way it is, right?
Mhm.
You need to motivate people to get there, right? You can motivate them, and you can demotivate them. These are things. These are the options available to you, right? Putting forward a policy that is inspirational, that is bold, that's going to answer the issues that they're facing in their life. That's how you get people to go out, right? Supporting a policy that is so like ugly and makes so much dissonance as to like how they view their own country, makes them ashamed, right? Like supporting a policy that literally makes them ashamed of the party is a demotivator, right? And we can cry all day long. This is what the Democratic Party does. We can cry all day long about how it's the voters' fault for not supporting, right? You can pretend to do that, or you can realize the truth. That's the politician's fault. What are you putting forward? What is the campaign? It's up to them. Blame the powerful. Stop blaming voters. Stop blaming everyone else, right? Zohar Mamdani just showed us this. He record-breaking participation in the New York mayoral election, right? Like they usually have very tiny participation in those elections. Record-breaking. Why? Inspirational policy was put forward. They gave a reason for people to come out, right? You can either give them a reason to come out, you can give them a reason to stay home. A genocide is a reason to stay home.
I mean, Mamdani is the living essence of like what I've been talking about, and the fact that I really don't think that people voted for policy there. I genuinely don't. I think it's a vibes thing and he very, I know he really talked the single issue, really talked about affordability and that kind of stuff. He definitely brought it up, but I genuinely don't think that he is sitting here talking out all of his plans. And
Mom Donnie literally, what he did, he literally listened to the people at the start of his campaign, right? He literally was on the streets. You can look at the video of him doing it, right? On the streets, talking in the videos. Hey, what are the issues you're dealing with, right? I'm going to tailor my campaign to specifically what New Yorkers want, what it is that is making your life miserable, and he tailored it to that, right? And when people are, when you see people discuss this thing, the thing they bring up are the policies they're excited for. Not because he just had a smile, right? That none of that mattered. He had no name recognition. He had zero name recognition. No one knew who he was. Why pay attention to this guy, right? Because he's handsome? Because he knows how to make a TikTok video?
Yes, he's young. Yes, he's young. He's relatable.
Oh my God, seriously?
Yes, he's the content creator. He's the content creator.
This is such cope. Cope. They're on other campaigns have run great. Bernie Sanders ran a great campaign as well, right? But he had the Democratic Party against him there, and he couldn't overcome that as well. But people can run a great media campaign and still lose. It was the issues that did it. What do you so now it's again so. Greg, you're doing all the things that I was saying those liberals are doing, the Democratic Party is doing, right? Hey, it has to be anything else. It has to be anything else but an examination of the powerful, of the politicians, right? Run interference, no matter what. Run interference for the politician. Run interference for the powerful. No matter what, it can't be their fault. No matter what, it's everything else's fault. It's everything. There must have been something unprecedented, something special about the last election, right? It can't have been a complete and rank failure of our policies. It can't have been that. And so we don't have to examine that. We don't have to change. That's what you're suggesting right now.
No, dude, I mean, I agree with you. I agree with policies wise. I agree with you and Mamdani and I'm Bernie and all. I mean, bro, I'm.
Who was the problem then? Stop. No, who was the problem? Was Joe Biden the problem? Was Kamala Harris the problem? Were they the problem?
The policies that they passed weren't the problem. That's for sure. I mean, because they did good. They did really. They actually did a good job at passing.
Yeah, landslide lost, right? Lost the vote, right? The raw vote. They lost that vote. They lost 7 swing states. A complete rout.
Yeah.
And that's why, right? Because they were doing so well.
And this is going in exactly because of the algorithms, man. They lost in the algorithms.
Algorithms. I'm sorry, I can't take anything seriously. Okay, we're gonna have to agree to disagree. I can't take this any of this seriously.
That is my hypothesis. That's what I've been talking about.
And it's a bad one. And it's an awful one because you're just again. It was the algorithms, guys. It was the algorithms. It was everything but the the candidate. You're going to come up with an endless excuse, right, as to why it can't have been Joe Biden. It can't have been the powerful, right? The powerful were innocent. It was everyone else. Everyone else.
But dude, guess what? Mamdani in New York is going to have the same problem with the algorithms, and that if he doesn't win in social media landscape and in the algorithm world, then none of his material conditions that he's improving, all of the numbers that back up the successes that he's going to have, they're going to be nothing if he doesn't actually win in the algorithm game.
Great.
That is the battlefield that we have to fight on. That is what we have to fight.
Great. It's the algorithms. Okay.
Yeah. That's what I think. That is my.
It's a dumb idea, but okay. We'll have to agree to disagree.
Okay. That's fine. Corey, you have anything to say?
Well, so I think there's
for you guys. I was going to give you guys the speak out if you wanted it.
Well, I don't think it's so black and white. In terms of I agree with you, Greg, that the algorithms are a problem. I brought up the information landscape, but I also think Prime has a point in terms of I don't think you could just wholeheartedly say that it's only the algorithms, that there's nothing about Joe Biden or Harris themselves, as in you're essentially saying that would it be then fair to say that nothing has to change, candidate or policy-wise, only the algorithms have to change? Because then I would disagree with that.
I think that Biden should have changed and done more communication and talked about things a lot more and been more upfront and put his name on things that when they passed it, and put, they had a failure in executing the legislation that they passed, and they left $400 billion in piggy banks basically, and they didn't actually bring that out. They only famously built like 2 EV charging stations when they had hundreds of billions of dollars for EV, for electric, infrastructure and, grid deployments, and they just never spent that money, and then it got taken away and used for tax cuts for the billionaires. So again, it is it's a lot of like administrative things, but I think Biden is the most successful legislative president since LBJ. That's just the fact.
I'm not disagreeing with that. I think you should have been involved in our debate yesterday then, because then it goes down to the question that I think I posed yesterday in terms of do you think either Biden or Harris's position on Israel Palestine had any effect whatsoever on the election outcome?
It absolutely did, based off of the Michigan vote, Michigan alone. There was like a 40-point swing in major swing cities that made them lose, Yeah.
Okay. Well, then I think then as long as you, or rather, if you acknowledge that, then you're different than the panelists that we ran into yesterday. That's all.
Yeah, I think it'd be naive to say otherwise. Obviously, it had a big impact.
But then to that point, then it's not, well, I guess you could still have the position, but then I would say then it's not only the algorithms. Then there is something about their actual positions and the actual candidates themselves and their positions on certain things that had an effect on the election as well, not solely the algorithm.
I think that people that were really adamant about Free Palestine, their feeds were flooded with pictures of dead Palestinians constantly, and they were seeing and they're looking at this just like that trans issue that people were talking about, and it's like, oh my gosh, every time I refresh the page is another picture of a dead Palestinian. Every time I refresh the page is another issue of a trans issue that Kamala is doing. So again, it's like,
although to be fair, I don't know that actually reflects Prime, because I don't think Prime really consume social media all that much. They're not on Twitter, and he just recently got a TikTok, right? So then, so I don't think. Again, this is just an N of one.
Well, the difference is that the trans issue is completely contrived and concocted by fake news and probably Russian saboteurs trying to sway the election. And I would
agree, it's heavily amplified.
Israel and Palestine is a legitimate issue, and that is something that they should have been dealt with. And it was a genocide, and it is a genocide, and it's awful. I think it is abhorrent, and it's awful. There's nothing else to say.
I think we all agree there on that point.
But I do think what's frustrating to me is that, again, 500,000 people, in Sudan. You have Libya, you have Syria, another 500,000 people. We have 1 million people dead in that region, and we have talked about, destabilization of the Middle East for a long time, and there's over 1 million people that have died in the last the last 3 or 4 years, and that Syria is in an open civil war. It's just, yeah. I don't understand why we don't talk about the other 1 million people that have died. That's what I don't understand.
Why we always focus on the one genocide?
I think it's because
anyway. So there's here's an excerpt from a New York Times article, right? And everyone can look it up. A father, a son, and their $108 billion push for media moguldom. These are 2 different paragraphs I'll read. First, Mr. Trump has privately said Larry Ellison assured him that he would turn CBS News, which the Ellisons took over when they bought Paramount, into a more conservative outlet to people of knowledge of the president's comments said, right? So That's almost in a paragraph. That's a one sentence. But anyway, and the next thing, those criticisms of CBS News also line up with those lodged by Mr. Trump, who has forged a close relationship with Larry Ellison. Mr. Ellison was once a stalwart Clinton-era Democrat, but he has gravitated toward Mr. Trump in large part because of the president's support for Israel. Several people who have spoken to him said. And then in parentheses, both Ellisons are close to Benjamin Netanyahu, the Prime Minister of Israel, the one associated, who one associate described as like an uncle figure to David Ellison, the younger one. So you can look that up. New York Times article that didn't come up came up just a few weeks ago, like 2 or 3 weeks ago. This was reported out. This is all out there. I mean, this is all out there, right? If you're concerned, you should have said like it's the algorithms. You're concerned about the algorithms. Okay, well, back to what I was saying previously. Those algorithms just got taken over by billionaires who support Israel. I mean, I don't know what to tell you. And to be clear, let's not think this is just a Trump thing, right? Because the push for the sale happened under the Biden administration. Let's not forget that. The Biden administration absolutely wanted the sale.
No, they didn't want a sale. They wanted the ban. They put the ban in place. I don't think that they were necessarily.
Actually, that might be correct. Yeah, it was the same thing, but the reasons were right because of his support of that uncontrolled messages about Israel abounded.
It was about.
They know pretend, but it's about China. I know they pretend it's about China. It's not about China. Yes, that's what they said all the time, but this was not about China. We have statements from politicians, right? Like what's his face? He ran for president previously. He was a Republican, and I'm blanking on his name. A former Republican president. I'm sorry, I'm blanking on the guy's name. I'm blanking on.
Yeah, ran for president or was president?
Ran for president.
John McCain.
Not John McCain. No,
Mitt Romney.
He's a billionaire. Mitt Romney. Thank you, Mitt Romney. Mitt Romney makes a statement, right? It's like, what's happened with TikTok? This was like I believe during the Biden administration, right? Like, what's happened with TikTok? The Israelis, they were so good with propaganda. With getting their message out. You didn't say propaganda. With getting their message out before. And they were talking about like how this uncontrolled media landscape. They weren't talking about how China was they don't care about China, right? They don't care about like keeping data safe from China. None of that mattered, right? Like none of that was a problem previously. The problem is that this platform was unregulated. They'll tell you China. They'll keep saying it, but all the evidence says otherwise. Netanyahu, in a meeting, recorded. This was like last year. Recorded meeting, talked about like goals that had to be done. Like what do we have to do to change the media landscape? What's important priorities for Israel, right? He said specifically TikTok. We got to do something about TikTok because they know what's happening on TikTok. Like this is all out there. Netanyahu, I can find you that quote too. I have my sources. Trust me, I'm very well researched on this. I can get you that source as well. But Netanyahu specifically talked about TikTok, how that was an issue, and now it's taken care of.
Probably because Trump was the one that shut it down and then let it go. Like now let it above, and now TikTok is basically at Trump's behest, existing in the United States still.
Yeah, because the Zionist is now in charge of it.
Like because Trump is in BB are fierce allies, close allies.
Sorry, yeah, but so was Biden. Stop pretending otherwise. It's BS, and I'm not going to let it slide. Stop pretending otherwise. He said again and again, I am a staunch ally of Israel. Israel's defense
As a state,
cannot be
not as
compromised.
as
That's
a
what he did the
ruler.
entire time. Stop pretending otherwise.
No, he agreed with
No, stop.
Israel as a state that exists, not as
Yes, as a state
not
exists.
as
Yes, that's the usual pablum. That's the usual talking points that they say. Like, but he made sure I am an ally. I said it again and again. I am an ally of this nation. This is what I'm gonna like, and by that I mean like he is talking in the context of continued support of Israel during the genocide. That's the context. So like I sure like I think you're just willing to swallow Democratic talking points. I think you're just willing to swallow them completely. I think you just are afraid of actually confronting what these politicians. I think you are voting for, and this is, of course, is your goal. Your right to do so, right? Everyone has a right to decide how they're going to vote. I think you're just voting for Team Blue. I think you're voting against Team Red. I think you're just voting for Team Blue.
Yep.
And so when we criticize Team Blue, right, and we say, hey, man, maybe they're not doing something right, you run interference. It's like that's everything else. It's the rules of the game. It's the referee. It's the weather, right? It can't be Team Blue. It can't be with the star players. Absolutely not. Never the players, never the powerful. That's what you're doing.
Really. There is no other team. That's the thing, is that it's either the Republicans or it is Team Blue. So
I can assure you, I'm aware of the structure of the American.
So then what else do we do, man? What else do we do?
I'm not telling what you do. You do what you want to do. And I think what you're going to do is just run interference with Team Blue. What I'm going to do is I'm going to have standards. And if you do not meet my minimum standards, you will not get my vote. Minimum standard, don't support a genocide. But, that's just me.
I think we have to. We exist in the political reality that we live in, man. I mean, it just sucks.
Yeah. So we got to support people who support a genocide. We would just it's just not a reality. I understand.
But you're never going to create. You're never going to have a candidate that says
yes, I know. Then you're going to argue. You're never going to have a perfect candidate. You're never going to have one that's exactly what you like. This is the nonsense that you always give. Like I've heard. Greg, I can assure you, I've heard it all before. You're not giving me anything new here. I'm not one bit. Okay. Not one bit. And none of it's useful. None of it's useful. Like and again, you're trying to assuage your guilty consciousness about this, right? By trying to argue with me and maybe get a tiny bit of agree with me. Oh, well, maybe things aren't so bad with the Democratic Party. I'm not going to do that for you. You're going to have to live with your vote. I'll live with my vote. I'm not going to do that for you. The Democratic Party supported genocide wholeheartedly. I'll never forget it. Not to the day I die. I'll never shut up about it. I will never, ever shut up about it. I'll remind people when people in family gatherings, when people try to do the same thing, right? Make excuses for them. I'll bring it up. I don't care. Like Corey knows. He's seen me over these past 2 years. He's watched me every time. I don't care. I'll bring it up every time. I won't stop.
Okay.
So like,
I'm not asking
don't bullshit me.
I'm not. All right, so it's 3 a.m., guys. What do you want to do?
I'm gonna leave it there. It's fine.
Okay.
I think we should agree to disagree at this point in time. I think
we gotta agree to disagree. Indeed.
Sounds good.
And to be clear, and Corey knows this about me very well, right? I disagree vehemently with people who are more disagreeable than Dr. Greg on a regular basis. And people who say awful things, right? Dr. Greg and I have a political disagreement here. It's fine. But I have greater disagreements with other people, like straight up conservatives, who say awful, awful things. But I interact with them all the time. In fact, they're friends of mine, right? I can disagree with someone politically, vehemently, but still, talk to them, operate them, and assume that they're operating in good faith as well. So to be very clear, if people think I think otherwise, or I think poorly of Dr. Greg, go. I'm used to the political arena. People aren't going to agree with me. It is what it is. But I don't burn down friendships because Corey can attest.
Yeah.
Just to give you guys
Prime
the
still associated with me despite me being Canadian. That's a big deal.
A big deal.
So to give you guys the option, there's one person that's in the guest request line.
I'm like,
3 a.m.
well,
I mean, you
I
guys
don't mind
think-
giving like a few minutes unless they want to do a whole rant or whatnot. As in, I'm open to hear what they have to say, but I'm also
let's hear what they have to say. I don't know how long I'll stay, but let's see what they have.
Okay, that sounds good. Thanks for staying, guys. Oh my gosh, Venezuela has said it's from the U.S. Oh my gosh. Okay, Truth, how's it going, man? Welcome.
Hi.
Well,
Hey man, could you turn on the TV in the background, please?
Yeah, too loud. Yeah, I'm turning down the TV too loud. Hold on again. Yeah.
All right. What's up?
He's a truth teller, free thinker on YouTube.
You have a question, comment?
Yeah, Truth.
I don't know.
Did you want to be here at all?
Nope.
Yeah.
I guess not.
Okay. All right, whatever. All right. Well,
We did it. We tried.
Yeah.
All right, guys. Well, thanks for coming on. As always, thank you. I appreciate it, and yeah.
Likewise, yeah.
Absolutely.
All right,
and hopefully we'll do it again next week.
Yeah. Could you give your shout outs or your closing?
Corey?
Yeah. I'm Corey Campbell. I'm a biochemist. You can find me on Twitch, Corey Campbell 84, Twitter, X, YouTube, Instagram, TikTok. It's Corey Campbell. And yeah, as always, this is a great conversation and a passionate conversation towards the end. But like, yeah, despite the differences, like, you're all friends to be. I'm grateful to be here.
Absolutely. I second all that. You can find me on YouTube, Kick, and twitch.tv/PrimeKai, PRIMECEYES. Also TikTok. So follow me. And yeah, appreciate the conversation and hope to be back next week.
All right. Yeah, man. All right. See you guys soon.
Take care, everyone. Be well.
Bye.
Happy New Year.
Bye.
Yeah.
Happy New Year. Indeed. Bye.